YouTube is on. Okay, so I'm going to do a sound check for the presenter. And now I'm going to start. And I will go in and check the city's web. Uh-oh. I started YouTube. It's okay. That's why we're doing it now. I'm back in. Okay, so I've gone back to meeting in progress and sound check for the presenter's laptop. And now I'm going. Presenter. Okay, so I'm going to go back to pre-meeting. I'm going to just test again. Test sound check for presenter's laptop. Speaking too quietly. That would be a first. Good morning.
Oh, okay, wait. There's one more button to push. Thanks, Janet. I did receive your advice through email, and I will do exactly as you say. I'm going to close this test vote and try another one in a few moments. Thank you for your patience.
never watched that show.
2, 3, 4.
Oh, I love that
6.
show.
All right, folks, let's get started on our Board of Health meeting this morning. Members of the public are our meetings are webcast live by the City of Hamilton, temporarily archived on the city's website. All electronic devices are to be switched to a non-audible function during our council meeting, and you are reminded of the 5-minute time limit, which will be adhered to during this meeting. Members can submit other requests to speak if they require more time or questions or comments. I'm going to go to the roll call. I'm going to call for attendance for Councillor Wilson, please.
Good morning, present.
Good morning. Councillor Farr. Councillor Nand.
Good morning, present.
Good morning. Councillor Marula.
Good morning, Mr. Mayor.
Good morning. Councillor Collins.
Good morning, President.
Good morning. Councillor Jackson.
Ward 6 has joined you, sir.
As usual. Thank you. Councillor Pauls. Not as yet. Councillor Danko.
Pardon me,
Oh,
Mr.
I see
Mayor.
you there.
Councillor Pauls is there. Just need to unmute your microphone there, Councillor Pauls.
It's okay. We see her there. We're good. Councillor Danko.
Present.
Good morning. Councillor Clark.
Good morning, sir.
Councillor Pearson.
Present. Good morning, sir.
Good morning.
Yep, good morning.
Johnson.
Good morning.
Good morning. Councillor Ferguson.
Yeah, present.
Thank you. Councillor Vanderbeek. Not as yet. Councillor Whitehead. Not as yet. Councillor Partridge. Not as yet. Thank you. Okay, Madam Clerk, are there any changes to the agenda, please, now that we have quorum?
Yes, Mr. Mayor, we have several changes to today's agenda. 2 items that were posted this morning are the presentation on the Radon report and also the presentation regarding COVID numbers. You'll see them in the agenda now. We also have added communication item 5.2, correspondence from Margarita D. Antoine Nano, respecting the mandatory mask bylaw. Item 5.3 has now been withdrawn, which was correspondence from John Neary, MD, respecting tighter measures to prevent the spread of COVID. There was an error in distributing that. The letter was essentially meant for Dr. Richardson and the mayor. Also, we have an additional item 5.4, correspondence from the Ministry of Health respecting AIDS and hepatitis C programs, and that is to be received.
Okay, can I have a motion to approve the agenda as amended? Moved by Pearson, seconded by Ferguson. Any comments or questions on that? If not, all in favor electronically? I think we indicate Councillor Farr is present and voting in the affirmative. Anyone else need to do a hand signal vote? Councillor Pauls, thumbs up. Thank you. I'm going to assume that is carried. Members of council, are there any declarations of interest? And we can please indicate Councillor Vanderbeek present as well. I see none. Thank you. Can I have approval of the minutes of October the 19th, 2020? Minutes are before you. Could I have a motion to approve that, please? Moved by Pearson, seconded by Vanderbeek. All in favor? Again, electronic vote.
The vote is up.
Thank you. And Councillor Farr, do you need to do a thumbs up? Or are you logged in yet?
He has
No,
voted.
you're good. Councillor Pauls, you're good. Thank you. And that's carried as well. We have communication side items 5.2 and 5.4. Any comments or questions on any of those communications items? Councillor Ferguson, go ahead.
Yeah, thank you. I know 5.3 has been withdrawn. It was a letter addressed to Dr. Richardson, and we got that letter in the weekend along with Dr. Richardson's reply. And I just want to congratulate Dr. Richardson. I thought it was an excellent reply, very factual, very to the point. And I know it was concerning to get that letter signed by, it looked like just about every MD in the city. And so I thought she put out a very, very good reply that was balanced and fair. And I just wanted to thank her for that. That's all.
Okay, thank you. Any other items on communications? Not seeing any. I'll take a motion to approve the communications items moved by Danko, seconded by Nan. All in favor electronically as well? Thank you. That's carried. We have a request, item 6.1, from Anja Drechovic, respecting mandatory masks during physical activity. It's for a future meeting. What is your wish? Do a motion to approve that delegation? Fire up a hand, somebody. Councillor Pearson, thank you. Seconded by Councillor Jackson. Favor then? Or opposed? Excuse me. Councillor Paul, is your thumbs up? You voted? Good. And that's carried. Thank you. We're going to go 7.1. 2020 Board of Health self-evaluation. Dr. Richardson is here to answer any questions. If there are none, we can approve that self-evaluation as a consent item. What is your wish? Can I have a motion?
I'll move it.
Then? Okay, moved by Ferguson, seconded by Pearson. Thank you. Any comments, questions? Hearing none, all in favor then? Or opposed? Thank you. Sorry, Johnson? Nan, able to vote? I don't see her at the moment, yeah. Okay. There you go. Voted unseen. Must be combing her. So we have a delegation with us today. Kaylee Metler. Kaylee is delegating respecting the 5G rollout in the city of Hamilton. That was approved at our October the 19th meeting. So I wanted to take a moment to welcome Kaylee. Kaylee, you have 5 minutes for your presentation, and we're delighted you're here. So the floor is yours.
Thank you for having me. So my purpose today is just to give a little bit of awareness of some of the concerns that I have as a resident and a few others that I've been speaking with. So I don't have much time, so I kind of get right to it. So from the Canadian Cancer Society, we know it's projected 1 to 2 in the coming years, and 1 in 4 will die, unfortunately, from cancer. And those rates are very alarming to me, and I'm sure they are to you. You guys probably know someone going through cancer. It's not a fun thing. And I just kind of want to ask you guys from kind of your caring hearts, do you guys believe that electrosmog that's going to be cell phones, Wi-Fi, 5G has anything to do with cancer rates? So that's just kind of what I want to bring awareness to. And I'm a health professional. I'm a personal trainer and a nutrition coach. and people are not moving. We know that they're not getting their 10,000 steps. And I just feel our society is so involved in electronics. I'm a mom of two. We basically are required to be on our computer a lot for everything. And I'm sure you guys are the same. You're feeling strapped to the electronics. And I just feel that Hamilton can take a stand and make a change. And the 5G is part of this. And with the 5G, I'm not sure if any of you guys have read up on it, but there's a lot of dangers that have been proposed. The WHO has done a study about thermal heating, so that's how it heats up the body. I don't believe that's enough of a test. I believe that we need to have the communications committees held accountable for carcinogenic testing. And there's Brussels was one of the cities to stop the 5G, and as their counselor said, he's not up for giving his residents being guinea pigs to 5G. And I just feel as Hamiltonians that perhaps you guys would feel the same, that you don't want our residents to be guinea pigs to 5G. And I just basically leave that there. And if you guys have any more questions, there's lots of studies and other things I can quote. One other thing I wanted to mention was Senator Bluthmel in the US did go to court and ask the FCC, which is the Communications Committee, if there had been testing done. And they had admitted that there hadn't been sufficient testing done. And it feels that we're just rolling out this 5G without the proper testing. So that's what I wanted to bring awareness today, and just ask that you guys help take a stand for our residents. Thank you.
Okay, thank you, Kaylee, and thank you. We have some questions from members of council, so I'm going to turn to firstly Councillor Ferguson, and then Councillor Marullo. Councillor Ferguson.
Yes, thank you. And Kaylee, were you the one that wrote to me about this issue?
I'm not sure if I wrote to you. I did write to my councillor Partridge, and I did write to David Sweet, and he did call me back, but I didn't get a chance to get in touch with him. So I'm not sure if you were the one. I don't think I included you.
Okay.
I'm not sure.
So it was somebody else. My office was contacted, and I directed them to reach out to Dr. Richardson because she's a healthcare expert that provides advice to us. Mr. Mayor, is it okay if I ask Dr. Richardson a question now, or would you like me to wait until we receive the delegation?
No, I think you could go now, yeah.
Okay, thank you to you, Mr. Mayor, then to Dr. Richardson. Dr. Richardson, I'm sure you've seen the data on wireless, whether it's Wi-Fi. I know that Bell is putting 1 gig service into the rural areas wirelessly through their towers. Through your research, have you found any reason for concern with this?
Doctor?
Through you, Mr. Chair, the research on 5G is currently being reviewed by Public Health Ontario, and I'm going to ask Dr. Harvey to speak to it. There was an information update for all of you, and I apologize for the events of last weekend. We didn't get it out to you, but we will have it out to you ASAP this morning. But I'll turn it over to Bart.
Dr. Harvey?
Through you, Mr. Mayor, as Dr. Richardson has indicated, we've been in touch with Public Health Ontario. They're in the midst of doing a review and tapping out to other resources across the world. Unfortunately, the COVID-19 pandemic has slowed them down on completing that. So at this point, I'm not sure that there is a sufficiently definitive word. Certainly 4G has been looked at and been experienced with. Yeah, so I think that's all I would be able to add at this point.
Okay, because the 5G installation started in Ancaster, and in another 3 weeks it'll be finished. So it's going to be available to all our communities. So, you know, she says that she's a healthcare expert and knowledgeable in this area. She sounds like she is. So I'd be curious to know from our public health department whether we need to be concerned, because certainly us as members of council are not qualified to take a position on this one way or the other without advice from our health department. So thank you for that, Mr. Mayor.
Okay, thank you. And Councillor Marullo?
just along the same lines, Mr. Mayor, and I appreciate the delegation today, and I think it's important because I've heard this in various circles, and some people are taking it very seriously, others are taking it lightly, but we really don't have a position. And I think at this point, through you, Mr. Mayor, am I hearing that we're waiting for the province to conclude their study before we take a position? Through you, Mr. Mayor.
Yep. Dr. Richardson?
Through you, Mr. Mayor. Yes, we are. This is one of the areas, as I mentioned previously, where we have Public Health Ontario doing a review of the issues. We don't do a parallel review, especially during these times. We don't have the resources to do this. We would have to hire outside expertise to assist us with that review. And so we're relying on Public Health Ontario to do that review. And of course, it is actually the federal government that's responsible for management of that overall spectrum and would be responsible for their overall review in implementation. But there is an Ontario review that's ongoing.
And through you, Mr. Mayor, is there a federal review that's been conducted at all, or any other province that has completed one?
Through you, Mr. Mayor, at this point, we just do not have the resources to go in and do that work. It's entirely dedicated to COVID.
I'm sorry.
To even go and look for the reviews right this moment.
Oh, okay. I'm just wondering if they had actually completed the reviews. That's all. But I guess I can search that out myself. All right. So Katie, we're just waiting for the province, through you, Mr. Mayor, apparently to conclude on the study itself, and I hope that gives you a little bit better understanding of where we stand before we make a position. And I appreciate your time. Thank you.
Okay, thank you. Councillor Clark, and then myself. You'll need to unmute yourself, Councillor Clark, sorry.
Is it working now?
Yes, it is, yeah.
Thank you, sir. I'm not sure who to ask this question of, but what is our role, responsibility, or obligation with regards to the approval of 5G within the region of Hamilton?
Thank you. Doctor or Bart? Harvey?
Through you, Mr. Mayor, my understanding is that's responsibility of the federal government.
So if we have no authority on it, I'm struggling to understand. I guess it would be a question for the province, but I'm trying to understand what the province is studying if it's under the federal jurisdiction.
Through you, Mr. Mayor, I think it's for similar reasons that you're expressing concern that the provincial government wanted to be informed that it's a question that is coming up to health units. And so when those questions do arise and when there is information sought, it is Public Health Ontario who undertakes those reviews for us.
So the results of those studies will be used or will be shared with the public, but at the end of the day, Hamilton still has no authority. Is that what I heard, Mr. Mayor?
That's what I heard, yeah.
Okay, thank you, sir. I appreciate that.
Okay, thank you. And if I could, Councillor Vanderbeek, take the chair for a moment. Is there any information on 4G? So this is, it's not like, this is the first time we've laid cable in the ground to transmit signals and waves and get reception. So has there been any information garnered around what the impacts of 4G is in our community?
Dr. Richardson?
I'm going to turn that over to Bart.
I was just looking at Bart, and I should have said, Bart, could you answer that, please?
Yeah, I think so. We have longer experience with 4G. I think the difficulty here is these are observational studies. Experimental study is never possible. So, at this point, the general conclusion has been that it doesn't pose an extraordinary risk, but it's a continuing to be well debated, and I think in some fronts, controversial decision or discussion that there is no, and I'm not sure that there will be a definitive answer coming forward.
Okay, thank you. And for those I've heard someone ask what 5G is, which is actually fifth generation fiber optic cable, essentially, with much greater capacity. So much greater speed, much greater broadband speed, all of that being considered today to be as important as electricity and water and any of the other utilities that we certainly consume. So that doesn't mean that there may or may not be concerns around that, Kaylee, and I thank you for your presentation. So there's, I guess, more information to be got from all of that, and you're free to share whatever information you have to with members of council for their information.
Thank you. I just have one thing. I'm really concerned about them actually turning the 5G on without the study. That's where I'm very concerned, and I just feel that we must have some right to do that. As me as a resident expressing my concern, I just feel it's hard to hear that you guys don't have the power to say no.
Well, we like to have the power to say yes on a lot of things, but unfortunately, that's not where we're at. There are different layers of government, and they have ultimate authority. Can we make our concerns known? Should we have concerns? That is certainly possible, and we do. So by example, today we find that the conservation authorities act is being changed significantly by the province of Ontario. We have no actual authority over that, but we certainly have very serious concerns, and I think we're going to let the province of Ontario know what our concerns are very aggressively. So it's not like we don't have a voice, but certainly the ultimate authority lies with other levels of government on these matters. Kaylee, thank you very much for your presentation. Can I, Councillor Ferguson, you have another comment? Go ahead.
Yeah, Kaylee, one last question then. You said you spoke to David Sweet and you heard this is a federal jurisdiction area. How did he respond?
You need to
I can't
unmute
hear you.
yourself,
You must be
Kaylee.
muted. Are you, Kaylee?
Yeah, she is. Yeah.
Sorry about that. I didn't, unfortunately, we exchanged emails, but I didn't get to speak to him because we missed each other's call. So he knows my concerns, and he called me, and we just didn't get to continue chatting about it. So I hope to talk to him about it whenever both our schedules allow.
Okay. Okay, and as the mayor said, conservation authorities are going through an upheaval, and it's not our jurisdiction, but we'll be taking a position on it. And very similar to the location of cannabis stores, we would like to license them, but the province says no, so they can put them willy-nilly wherever they want. So there's some things we don't have any control on. And I thank you for your delegation today.
Okay, thank you, Kaylee, very much for your presentation, and have a good day. Can I have a motion to receive Kaylee's presentation, please? Moved by Ferguson, second by Clark. All in favor? That will require an electronic vote. Whenever we get it. As I knew it was coming. Thanks, Lauren. You're actually very quick. All right, thank you. That's carried. And we're going to turn to the next item, which is a staff presentation. Kevin McDonald is here to present on radon prevalence in Hamilton. And I'm sure we're all interested and keen to hear verbal reports. So Kevin, the floor is yours, sir.
Thank you very much, Mr. Mayor, and thank you, Mr. Chairman and members of the Board of Health. The Healthy Environments Division appreciates the opportunity to report to you today on radon levels in Hamilton homes. Just a bit of background, radon is a colorless, odorless radioactive gas that is the leading cause of lung cancer in non-smokers and estimated to be responsible for approximately 3,300 lung cancer-related deaths in Canada each year. Through work aligned with the Ontario Public Health Standards, the Health Hazards and Vector-Borne Disease Program led a team of public health services and other city staff in planning and developing and implementing a household radon survey that began in October of 2019, and it was completed earlier this year. So we're pleased to be able to come to you today and present the findings from that work. Public health survey findings indicate that approximately 1 in 7 homes in Hamilton likely have a radon level above the Canadian National Guidance Value, which is an increase from the previous evidence presented by Health Canada's radon survey, which was completed in 2010. It's estimated approximately 1 in 20 homes have radon levels above 200 becquerels per cubic meter. These recent findings in the are very relevant, given that lung cancer is identified as a top burdening health outcome in Canada, as reported on by our office in Health Check in 2018.
Kevin, can I just interrupt you for a second? Do you have a slide presentation? Do you have a presentation that you're working from?
Dr. Harvey is going to be giving the presentation. I'm just giving a brief background.
Okay, great. Thanks. Sorry to interrupt.
No, not a problem. The household radon survey analysis was led by our Associate Medical Officer of Health, Dr. Bart Harvey, our health hazard specialist, Dr. Sally Radisick, and Matthew Lawson, the manager of health hazards and vector-borne disease. So with that, on the template of that, I will now ask Dr. Harvey to present a more fulsome account of Hamilton's household radon survey, the associated findings, and the relevance for our local public health context here in the city.
Thanks, Kevin. Let me pull up the slides. Let me know when you can see that.
Yep, very good.
Okay. So as Kevin has alluded to, in 2012, Health Canada reported on the results from its cross-Canada household radon survey that it carried out between the years of 2009 and 2011. In that survey, we were made aware that 11 homes had been included in that sample, and 5% or 5 of those homes had been found to have a radon level greater than Health Canada's then and continues to be now kind of upper limit of 200 becquerels per meter cube. So that has been kind of used as the guide that 1 in 20 Hamilton homes would be expected to have radon levels of that amount. Prior to me joining the city, Matt and Sally and many other colleagues here at Public Health Services had felt that it would be worthwhile to explore the possibility of actually conducting an updated survey limited to Hamilton, which could have a larger number of homes included and therefore give a more precise estimate of what the percentage of Hamilton homes with elevated radon levels might be. As Kevin has alluded to, radon is this colorless, odorless gas. So you never really know that you have it or you don't unless you go through the 90-day testing process. It's produced in the soil of radioactive materials that can, if given the opportunity, seep into a home and accumulate in a home. Because these are radioactive particles, when they get inhaled into the lungs, they can cause genetic changes to the cells that can lead to a cancerous change. And as Kevin has alluded to, radon is currently viewed as the second leading cause after tobacco smoking of lung cancer. So for those that have never been smokers, this would be the leading cause of lung cancer. Kevin's already mentioned that the current estimate is that about 16% of lung cancer deaths in Canada would be attributed to radon exposure. And while there's no safe level of radon, Health Canada's guideline currently is this above 200 becquerels. And they would recommend that if a home does have a level of greater than 200 becquerels per meter cube, that remedial action be carried out within 2 years. And certainly a house that would have more elevated levels, greater than 600 becquerels per meter cube, then trying to do remediation within a year of that finding. And again, the highlight is that radon levels can really only be determined by testing. In the fall of 2019, Hamilton Public Health Services continued to carry out its annual radon awareness promotional campaign. So that's to increase public education and awareness of radon and to encourage people who haven't tested their homes to test their homes for radon. In addition, last fall, we used it as an opportunity to inform and to recruit homeowners in Hamilton to participate in the proposed and planned 2019-2020 household radon survey. The best time to test for radon is quote unquote over the heating season. So from about now or December into the early part of the year. The survey eligibility is listed here, essentially looking for adult homeowners who had a primary residence in Hamilton, no tenants living in the residence, no businesses where non-family members would be spending more than 4 hours, homes that weren't being planned to be sold or renovated in the following 6 months, clearly residents that hadn't been yet tested for radon, and looking for participants that would be committed to placing the detector in the lowest lived-in room and committed to keeping it in place for the required 21 days. And certainly this is the instance of looking for, because it comes out of the soil, you're looking for buildings where kind of the lowest level, so it might be a basement, it might be ground floor, depending on how the home is constructed, and looking for homes where that lowest level has a reasonable amount of kind of human occupancy, a bedroom down there, an office where somebody might spend a lot of time, a family room, et cetera. Because the radon will kind of dilute as it moves up and away from the ground. So this map is the, I think it's 143 census tracts across Hamilton. And what it shows you is the distribution. We had 294 homes that participated and completed all aspects of the study. So that would be keeping the detector in place in the lowest lived-in area of their home for a minimum of 91 days, mailing the completed detector to the company that supplied the detectors and also measures them. And then that company was able to generate what they felt was a reliable and validated estimate of radon level for that home. You'll see that the vast majority of census tracts have no more than 3 homes included in them that participated in the study. And then I think there's 16 or 17 census tracts where there were 4 or more homes included. The main finding from this was, of those 294 homes that participated, 42 or 14.3% of those homes were found to have a radon level greater than Health Canada's current guideline of 200 becquerels per meter cubed. And for comparison, that would be 3 times greater than the overall provincial rate that the Health Canada study found for Ontario, which was 4.6%. So certainly the 14.3%, quite a different estimate than what we got from the Health Canada study of 5%. This map will show you the percentage of homes tested in each census tract that were above the 200 becquerels per meter cubed. And then you'll see that there's also numbers included in the census tracts where those 42 are found, just to give you the actual number of homes in each of those census tracts. So you'll see that there is reasonable distribution of where those 42 homes are situated. The one thing I would highlight is, while 294 is clearly a larger number than the 100 that Health Canada included in their survey, spread across 143 census tracts, and even if you use forward sortation areas or other geographical markers, based on the results of this survey, we would not be able to rule out the possibility that any census tract in Hamilton, any geographic area in Hamilton, could have upwards of 18% of the homes that have elevated radon levels. So our conclusion would be that really there's no obvious indication that there's any place in Hamilton that is at increased risk, but there's also no indication that any place in Hamilton is at decreased risk. So our view is that these findings indicate, the continuing need for us to do our annual radon outreach, but even especially now knowing these results, increase that outreach and education efforts, including and especially to make the public aware, make homeowners aware, and encourage that if they haven't yet tested their home, we're now on the beginning of a heating season, so this would be a great time to get a detector put it in that lowest lived in area, and in early 2021 being able to have a result. That promotion will include increasing communication through transit shelters, the weather network, newspapers, social media, working with Health Canada and modifying their postcards. And I just found out this morning that I think that 153,000 postcards around radon will be going to Hamilton Homes very shortly. And as a result of this increase, and our Hamilton's Chief Building Officer, Ed Vanderwint, and George Catano, one of his colleagues, are at the meeting with us and available to answer questions as well. Because this increased risk, and Ed, you'll forgive me if I sound like I'm speaking for you, and I'm not going to do that, is that the Chief Building Officer of the city has the ability where something like radon is an issue. There are aspects of the Ontario Building Code that can be triggered, if you will. And my understanding is that Ed and his colleagues will be bringing a report, an information report, to tomorrow's planning meeting to indicate that though, because of the study's results, that those aspects of the Ontario Building Code will be initiated beginning, I believe, tomorrow morning. Thank you very much, and I'm happy to answer any questions that you may have.
Thank you very much as well, Kevin and Bart Harvey. Could just, you may have done this, but could you maybe reiterate what radon gas is? How is it created? I think there might be a perception that it's a legacy of environmental damage, when in fact it's not that. It's naturally occurring materials in the soil that are decaying and producing a gas. Can you just confirm that for our viewers, particularly?
Sure, absolutely. And Mr. Mayor, the only aspect that I'd add on top of what you quite accurately depicted is that it's radioactive material that's decaying, and that's really the issue. But it's totally natural uranium and other aspects in the natural ground that has the ability to decay and emit through the surface of the soil. And where you have homes sitting on top of that soil, that gas has the ability to make its way into the home and potentially accumulate there to pose the risk.
Okay, thank you. Thanks for clearing that up for me. In any event, I have a long speakers list, or questions list, I guess. Councillors Danko, Ferguson, Wilson, Clark, and Pearson. We'll start with Councillor Danko.
Thank you, Mr. Mayor.
Maybe you could take the slide down, Dr. Harvey,
sure,
so that we can see one another in the fullness of it all.
Do I just hit escape to do that?
You're asking the wrong person. Lauren?
Hi, Dr. Harvey. If
Hi.
you just hover your cursor at the top of your screen, there should be a little drop down that will tell you to stop. That will tell you to stop sharing. Should like just kind of drop down. There you go.
Perfect.
Thank
you. Thank you, Lorraine.
Right,
Great
thank
feature.
you. All right, Councillor Danko, go ahead.
Thank you, Mr. Mayor, and through you to Dr. Harvey or perhaps to Director Vanderwint. Good to hear that there's a discussion between public health and the building department as in terms of what can be added to our building permits. So through you to, I guess it's probably to Director Vanderwint, but what will we be requiring as part of the building code? And are we sure that the levels that we have observed qualify for a known problem, I think is the wording in the code.
Is Ed on the call today?
I am. Thank you, Mr. Mayor.
Okay, Ed, welcome.
Mr. Mayor, through to the councillor, the Ontario Building Code requires mitigation measures to be put in place when radon is known to be a problem. This isn't a choice that I make or that you make. This is an OBC requirement that must be done at this time, now that we are aware of it. I have George Catano, our manager of plans examination, on the line with us as well. George did the background work on this, and I'd be pleased to introduce him now.
I have to admit, Ed, I haven't seen you in a while, and the biblical beard is stunning.
It's a COVID item.
Yes, yeah. looks very smart. Last time I saw you didn't have any of that. No, we're Shows you how little contact we're having visually, unfortunately. But sorry, pass it on to your. Who you passing it on to?
Is George Catano on the line here?
George? I'm not sure if he is.
Through the chair.
He is?
Yes.
Okay.
Councillor, basically, like Ed said, the building code requires the chief building official take certain actions if radon is known to be a problem. And this is something that's been done by other municipalities such as Kingston and Guelph, which have similar numbers to what our health unit has found in Hamilton. We went basically from 5% from the Health Canada survey to 15 or 14.3%, which is quite a jump. So in the building code, there's three options that we are making available to builders. One is to rough in a mitigation system, just put in a pipe under the slab, test the home after it's completed, and if it's over 200 becquerels, you have to put in a depressurization system in the home, but it's easy because it's roughed in. The other option is to seal the basement and the foundation. The requirements in the code are very clear how you seal all the joints, all the cracks, make sure there's no penetration or there's no openings into the basement. And the last option is to put a full system in place already from day one with the fans and making it work right away. But that's basically what we're implementing under the code as of tomorrow. That's what the chief building official has determined. I don't know if I answered your questions.
Thank you. Councillor Danko?
No, and I understand there'll be further details coming to planning committee if I heard that right from Dr. Harvey. So just following on that, this is probably something that we can pick up in planning committee as well, but I'll just put it on the floor here, is that we're working through the secondary suites bylaw right now, which will be a lot of livable space in basements. So is there concern that we could be, need additional testing for existing homes that could be adding secondary suites? And could that be something that we would need to add in as a requirement for approvals?
Okay.
Under the building code, sorry, through the chair. Go ahead. Sorry, Mayor, did you want to?
Go ahead, George.
Okay, basically under the building code, we can't make someone retrofit an existing home. So if the basement slab is existing, the foundations are existing, we can't make them test or do anything. If you want to put something in the new bylaw, it's a voluntary process for the homeowner. Don't know if you can make it mandatory as part of the licensing of the secondary suite to make it mandatory that they test the unit, but it's not something we can do under the building code for existing homes.
So I think that's something we can pick up at planning committee, but I appreciate the discussion.
And there are ventilation systems that are available to help existing homes. As I understand it, Ed, there are things that homeowners could do to help if they have a high case of radon. Can't hear you just yet, Ed, if you're speaking. You need to unmute yourself.
Yes,
there you go.
Through you, Mr. Mayor, there are businesses out there that specialize in radon mitigation. It is possible to retrofit existing homes. That's correct. The OBC applies to new construction only, and that's our limitation in this process.
Correct. Yeah, on the building code side, for sure. Okay, Councillor Danko, you good?
Yep, thank you.
Okay, thank you. I'm sure there'll be more discussion at planning, and there are some issues that come out of that relative to secondary suites for sure. So the question is, how are they going to be dealt with? Councillor Ferguson, Wilson, Clark, and Pearson. Councillor Ferguson.
Yes, thanks, Mr. Mayor. And Dr. Harvey, I'm looking at your slide 10 and trying to understand how to read it. Am I interpreting this properly that the darker the color is, the more prevalent radon is?
Dr. Harvey?
Yep. So through you, Mr. Mayor, the coloration on so that would be the census tract slide that has the numbers that indicate the number of homes in each of those census tracts that tested above 200, correct, Councillor?
What's the purpose of the color then? It looks like East Flamborough has the darkest color, and it's in box 2. I don't think that's the number of homes. I think that's just the box number, is it not?
No. So I'm not looking at the map right now, but I'll do it from memory. I think I know the one you're looking at. So
it's slide 10, if you want to look it up on the. Sure. Everybody else has a presentation in their their system.
So if you look at the legend indicates the percentage of homes that were tested above the 200. So the color black are the census tracts where 100% or all of the homes that were tested in that census tract tested above 200. The 2 would indicate that 2 homes in that census tract were found to have greater than 200. So if that census tract is also colored black, it means 2 homes in that census tract were tested, and both of them tested above 200.
And then there's area 5 and area 8, which is the West Mountain. Does that mean there's 5 homes in the darker one and 8 homes in the lighter one that tested positive?
Correct. So again, the 5 is also in black, which means that in that census tract, 5 homes were tested. So 5 homes participated and completed the study, and all 5 of them tested above 200. The 8, I think, is in gray, which would indicate, I think it's somewhere between 75% and 100. So 8 of the 42 homes that tested above 200 were in that census tract, but there were more than 8 homes. There may have been up to 12 homes in that census tract that were tested. 4 of them tested under 200 or less. 8 of them tested greater than 200.
Well, those 2 areas, East Flamborough and the West Mountain, is where there's high perched limestone. Could the limestone being so close to the surface have an impact on bringing radon into these homes?
Well, it's not bringing it into the homes. It's present in the soil. Certainly, there's geologic factors. I mean, if you look at the Health Canada study, there's parts of Yukon, Manitoba. There are big geographic differences in kind of the prevalence of radon being found in homes. I mean, some areas in excess of 1 in 3 homes that were tested. So there's clearly a geologic component to it. And, you know, that part of the city, based on these 294 homes being tested, there's certainly, based on this, there is kind of a clustering, if you will, of homes that tested positive in, I guess, what I would refer to as kind of the Ancaster and Dundas areas. But again, the one thing I want to bring is that when we look at the survey, we can't really rule out any part of the city of Hamilton having upwards of 1 in 5 homes that would test greater than 200. Are there areas that are of particular greatest risk? I mean, I think our promotion will be to homeowners in Hamilton based on these results is, if you haven't tested your home from radon, we would strongly encourage you to do that.
Okay, and just on that, there's a story in the Spectator in the weekend about this, and they said radar detectors can be purchased at a hardware store. I didn't have time to go to Lowe's to find that out, but are they readily available, and are they relatively cheap? The number quoted, I believe, is $30, $35 each.
Yeah, my understanding is that it is in that range, and my understanding is that they are available.
Okay, and then a couple questions for either Ed or George, then I'll be quiet. The foundation drain collectors, particularly in Ancaster, because we never connected foundation drain collectors to the storm sewer in this community for decades. And so they have sump pumps. Do the foundation drain collectors collect that radon gas and then is it distributed into the house through the sump pump? Are they higher risk if they have a sump pump versus being connected to the storm sewer? Either Ed or George can answer that.
Through the chair, studies have shown that sump pumps will cause radon to leak into your home. That's why they recommend airtight lids on those if you do have a sump pump.
But that's pretty hard to do because you got your sump pump coming out, you got your discharge hose coming out, you've got your wiring going down to the motor. Yeah. So it's pretty hard to make that airtight.
There are lids available that are airtight, but what I would say then test your home to see if you exceed the 200. You may not exceed it. But okay, there is a pathway that through any cracks, a sump pump would be one of the pathways that radon gas could come in through the basement.
Okay, because as I said, Ancaster and Flamborough and Dundas seem to be the 2 highest areas. It's where the highest rock is in some parts, and also at least our community has all sump pumps. So I think we should recommend to the public, if they're concerned, they should go to Home Depot or go to Lowe's or another hardware store, buy a detector, and then what do? Do they send them the device in to get a record number, or is it printed out automatically right in your home?
So I think when they buy their detector, there will be instructions about where to place it, how long to place it there for, and then at the end of that period of time, what to do with the detector to be able to get the result. But my understanding is none of these detectors provide its own result. The detector needs to be sent to the provider, and then they will they'll examine it and send the homeowner back the result that they got.
Okay,
Okay,
thank
that's
you.
all
So,
my that's all my questions.
perfect. You're well beyond the 5 minutes, so thank you for that. And I'm sure we're going to be sending out information on how to process, once you have a detector, where it needs to go, and how that kind of process works. I think that would be very helpful for our community to know. I'm going to turn to Councillor Wilson.
Thank you, Mr. Mayor. Through you to whomever could speak to me about, just so I understand the methodology that was used for testing. I'm a little concerned about the picture, the map on slide 10, and I'm wanting to make sure I understand that. Is there not an issue with rental homes maybe not being tested because the owner may not be in their interest to have it tested? Could anyone speak to me about whether they think it's a fair representation of properties in each census tract?
So through you, Mr. Mayor, I can certainly jump in and take a first run at that. So this study, this survey is completely voluntary. So we promoted it in the fall. Public Health Services promoted it in the fall. We had a number of homeowners come forward, distributed detectors to homes that wanted to participate, and then 294. So I agree fully with you, Councillor, and it was never intended to be a representative sample of radon in homes across Hamilton, because we were totally dependent on people, like any research study, on people giving informed consent and participating. And so the one advantage methodologically is that many people would view that radon being detected is not really a clustered event. So you could have houses that are right beside one another and have very divergent results for a variety of reasons. But you're right. I mean, we have the results of 294 homes. Kind of the distribution of them, I think, is shown on slide 8. And there is representation across the city, but there's lots of census tracts that aren't represented. So this is kind of our best update of that 5 out of 100 that Health Canada gave us 10 years ago, to be able to get a better sense of, how prevalent is elevated radon in Hamilton homes.
Yeah, so I guess I would surmise there's definitely an equity issue in this, and I appreciate your comments that it was voluntary. But if the homeowner had to be English speaking and it had to be a homeowner, then we're precluding a lot of residences from Councillor Danko, and I know we will discuss it at length. I have some concerns about us with secondary dwelling units. I don't want us to get into another legacy of lead pipes in which we're enabling something only years later, having to retrofit something. If we're encouraging people to build basement apartments, then we should be testing for it at the outset as opposed to years later. Thank you very much for this work. It's really important. Thank you.
Thank you. Councillor Clark?
Can you hear me, sir?
Yes, sir.
Thank you. Just some really quick questions. On that slide number 10, there's an awful lot of white. So I understand there was 294 voluntary respondents. Do we know if every ward was included in this, or if there were areas of the city where there were no respondents and so no testing was done?
Dr. Harvey?
Through you, Mr. Mayor. You're right. There are lots of the census tracts that are white, which indicate there's no data. No homeowners from those census tracts came forward to participate in the study. On a ward-by-ward basis, to this group, I'll feel embarrassed to have to answer this. I don't know that we've examined the results on a ward-by-ward basis. We could certainly do that, Councillor. We first started to look at forward sortation area to see if that would give us, but there are some forward sortation areas that many of you will know that kind of multiple places across the city. So because we're doing the COVID-19 test or results by census tract, we thought let's use census tract for this to try to depict it geographically.
No, and I appreciate that. And I'm just looking at Upper Stony Creek there all the way to Grimsby, the town line, and it doesn't look like there's any data. And so I don't know what that means. I'm assuming that we can extrapolate from the main survey that there would be 18% of the homes in this area that would also have radar and gas, but that's purely an assumption without any scientific evidence.
Yeah, if I may, Mr. Mayor, I totally agree with you, Councillor. And that 18% is, I can't rule out any area in Hamilton having upwards of 18% of homes. But as you've quite nicely depicted, in no way, shape, or form, especially in those census tracts that had no homes, I can't make any observation about what the level of radon in those homes would be, because we have no data to guide that.
It could be lower, it could be higher. We just don't know.
Absolutely.
Can I ask Dr. Harvey, and you may not be the one to answer this, so you can punt it if you wish. Do we have estimated costs for a private citizen to mitigate a home with radon gas?
Well, I'll take a first run at it, and then I'll turn to Ed and George and see if they'd like, or anybody else would like to chime in. My understanding is it depends on the home, and it depends on what amount of work needs to be done to put this remediation into the home. But it would probably be somewhere in the neighborhood of probably no less than $1,500, but could be upwards of $4,000, depending on what the contractor ran into and what they needed to do to be able to put in the appropriate mitigation systems. And Ed or George, I will now encourage you to correct, clarify, or confirm what I've said.
Who wants to? George, you want to take that?
Chicken.
Through you, Mr. Mayor. Harvey's kind of correct. For an existing home, it depends on the age, what's under the slab. I've seen a couple going for $4,500. It's more expensive to do it after the house is completed, obviously. If you do when the house is being built, it's a lot cheaper. It may cost $500 to $2,000 to do a full system. So that's why we're putting this plan in place. It's a lot cheaper to do when the house is being built new than to come back later and try to rectify it. But I agree, for an older home, it depends on, somebody has to go there and basically determine what they need to put under the slab, how they're going to get that soil gas to the outside. I've seen could be up to 10,000. It depends on the complexity, but I think 3,000 to 4,000 is probably a good average for an existing home.
Thank you. And the last question, Mr. Mayor. So do we have any type of assistance program for private citizens to help them deal with these costs if they're find themselves in a situation where the radar and gas is quite high and they got to do something quickly?
I'll look to Ed, for that one. I think the answer is no, not Ed yet. Ed, do you want to? Again,
for you, Mr. Mayor, there is no program in place to address this. Building permit fees cover the cost of the inspections at this time. I wonder if, George, you want to maybe talk to the Tarion component of this.
Through the mayor, basically, if a new home is found to have high levels of radon, whether they have the mitigation plan or not, Tarion does cover radon mitigation in a new home. So you have a 7-year warranty. So if you build a house last year, let's say, or 2 years ago, new house, and it's under Tarion, and you test it and you find that it's over 200, they will cover the cost of that. It's insured, or it's under their insurance program.
Right.
So it's good to work on, but it doesn't apply to existing homes that are like 20.
I understand.
Yeah.
Thank you.
Councillor
Those are all
Clark?
my questions, Mr. Mayor. Thank you very much, sir.
Perfect timing. Thank you. Councillor Pearson.
Yes, good morning. Thank you very much for the presentation, Dr. Burt, and Ed, everyone in on this. Few of my questions have been answered, but I do want to ask, so when we're sending out the next round of advertising or promotion for people to encourage people to apply for the testing kits, there's obviously no charge. How many kits will we have available? How many people are we hoping to have participate in this survey?
Sorry, there isn't a plan to continue the survey. The survey was done last year. You're seeing the results here. The promotion that we're anticipating doing would be really continuing what we've been doing on an annual basis, making people aware of what radon is and how they can test their home. Last year we had the added ability because we wanted to get this updated and more precise estimate of the percentage of Hamilton homes that have elevated radon. So at this point, we would be promoting people or encouraging people, if they haven't already tested their home, to go and purchase a detector at Canadian Tire, Home Depot, wherever, and then follow the directions there so that they can get a result for their home. We wouldn't get the result back unless somebody wanted to share it with us, which we're not currently planning to ask people to do that.
Okay, thank you for that. And I know, George, you've answered some of the stuff about, existing and new homes. So if, say, someone has an existing home and they do, say, a weeping tile repair, so they have to dig up all around the foundation of their home, would that be the opportunity to mitigate? Now, you mentioned also having to go under the slab of the foundation. So what does that entail?
Through the mayor, if they're doing the weeping tile, again, it's an existing home, we can't make them tear off the slab. To do a proper mitigation, you'd have to put sealed under the concrete slab in the basement, and we can't do that under the building code right now because it's existing. It was built legally. We can't make them tear it up. If they did the foundation weeping tile outside, we tell them to dam-proof it or waterproof it, install it properly, but we can't deal with anything inside the home at that point.
Okay, but would it help if somebody had evidence of radon gas to do the sealing around the foundation of the walls?
That's a difficult question to ask because existing homes, you may not. The idea there, I think, what Dr. Harvey is saying is test the home, see what your radon levels is. You should, if you have any cracks in your slab, yeah, you could seal them, but then you might miss them. Around the foundation wall, you could have cracks all the way along where the slab meets the foundation wall, but that may not solve the problem. There could be multiple cracks where the pipes come in through the slab. There could be, it's very, and it could be hidden, could be under a subfloor that you can't see.
Got it, okay.
Basement, so
and thank you, thank you for that. So what about houses that do not have basements? So they have a crawl space or, something like that. So they don't have a finished basement. Then are they at a higher risk because it's now what, a 4-foot crawl space as opposed to a full 8-foot basement?
I think most people would argue through the mayor, most people would argue that that probably makes it safer because they have this additional level that's not really being lived in space. My understanding, and again, Ed and George, I will defer to you. My understanding is that because radon is coming in through the bottom of the house, the place for the greatest concentration is at the bottom of the house. So it's really lived in space that becomes the issue that people can be, because they're living in those spaces. So if you had an unfinished basement, a crawl space that people, only infrequently go down there and don't spend extended times, that they would be at lower risk. And, the next level from the house, I would expect would have a lower concentration of radon just because it's that much further away from the soil. But once again, I will turn to my colleagues from building to correct, clarify, or confirm.
So through to the mayor, thank you, Dr. Harvey, for that explanation. Radon comes from the soil and goes up through the slab, be it in the basement or on the main floor. Naturally, a ground level unit has more fresh air around the building to vent the radon out of the building. So when you're in the basement situation, the radon sits inside the basement foundation and of course accumulates in a higher level there, which is why Dr. Harvey recommends testing your basement first.
Councilor
Okay.
Pearson?
Yeah, thank you for that. And I think, let me see now. So I just want to ask, and maybe George, you can clarify. You mentioned the Tarion warranty. The Tarion warranty, is it the 7-year warranty just for the radon gas, or is that, because I don't remember the Tarion process? Is it just for radon gas? It's a 7-year warranty. Is that for everything on a new house then?
George?
Through you, Mayor. The warranty is, they warrant other things apart from radon. So you'd have to look at a Tarion warranty on the home. But Tarion is one of the items they do cover if they do find that there is a high level concentration in over 200 in your basement.
And that's 7 years for the radon gas.
Yes, that's the same with most of their other items are 7 years.
Okay, thank you for that. And thank you everyone for all the questions that have been asked and answered. Thank you.
Okay, thank you. A very important issue. Thank you all, Dr. Harvey and Ed and George, for your presentations. I will need a motion to approve or receive the presentation, first off. Moved by Johnson, seconded by Councillor Partridge. All in favor of that? It'll be coming shortly. And I've no doubt there'll be more information shared at Planning Committee tomorrow, and possibly some thoughts about how we're going to deal with that as a municipality as we move towards secondary suites. That's been pointed out. And that's carried as well. Thank you. I'll find my voice sooner or later. On item 9.2, the overview of COVID-19 activity, Dr. Richardson is here. Sorry. Oh, my apologies. Yes, we need a motion to receive the report. Moved by Jackson, seconded by Ferguson. All in favor? You're frozen. We will go with a, oh, okay, you're unfrozen. Okay, the vote is up. Thank you. Councillor Collins able to vote? All right, thank you. Dr. Richardson is here, an overview on COVID-19 activity in the city of Hamilton. Lots of activity over the weekend to speak to, and more on the way, no doubt. So, Dr. Elizabeth, the floor is yours.
Thank you, Mr. Mayor. Can you hear me okay? I've just switched back to my headset. Great.
Perfect.
So yes, it was a very busy weekend with the announcements and changes at the end of the week, which were all good changes, and but then just making sure that we were clear about where we sat as the new red level came in for Hamilton overnight last night. Today, what we're going to do is I'm going to just start off with a little bit of an overview about that piece, and then Steph is going to, as usual, give you the detailed overview of our epidemiology, and then I'm going to come back and just talk about a few other things. Steph is going to do me a favor today because I was just having some presentation challenges. She's going to pop up that presentation for you. Here you go. Can you put it into the presenter view or the that one? Perfect. Thank you, Steph. All right, if you could just go on to the next slide. So as I said, we're going to work through these different pieces, talk to you a little bit about vaccination and prioritization of our COVID-19 work, given the level of both disease spread and outbreaks that we're having. We'll talk a little bit more about how we're prioritizing work. So over to the next slide, please, Steph. So here is the framework that was announced on Friday with changes to the levels of thresholds that took us from one level to the other. And so you can see here, we still have the green, yellow, orange, red, and then gray lockdown levels. Each of those are include the weekly incidence rate. So this is the number of cases over a whole week per 100,000 population. The percent positivity, that's for test results and where that's sitting. The R effective, which is a measure of how many cases each case goes on to infect, essentially. And so if overall, when you look at that, the number is above 1, then the outbreak is continuing to grow. When it goes below 1, then the outbreak is shrinking. Overall outbreak trends and observations in the community and level of community non-epi-linked cases, and you've heard Steph talk about those. So you can see we have some that are quite numeric and sort of very clear-cut, and others are more qualitative in their approach. We also look at the health system capacity in terms of both hospital and ICU capacity, as well as our own public health system capacity to look at how well we're able to do case and contact follow-up. If you can just go to the next slide, please, Steph. So I'm just going to give you a quick overview of the numbers and where we sit on this slide. Steph is going to give you much more background, but you can see what's happened over the last 3 weeks. So as of Friday, we've got numbers for you here on these indicators. So at the week ending October 30th, we were sitting in the yellow zone. And so Carolyn and Steph have nicely color-coded these for you so you can see where we were sitting and see the movement. So we were sitting in the yellow zone on our weekly incident rate when we were at 22. By the week of November 6th, we were at 35. And as of Friday, we were at 52. And we've continued to hover at about the 50 cases per 100,000 mark here in Hamilton over the weekend. Percent positivity has slowly increased as well. We were at 1.5%, increased to 2% at the end of the week before last. And by the end of last week, we were up to 3%. And the effective reproduction number sat just below 1 and then has steadily increased up to 1.25. We've also had an increasing number of outbreaks. We were at 19 outbreaks on Friday. I think we're at 18 or 19 today. And a number of outbreaks, unfortunately, have had more than 10 cases. At the end of the spring wave, we saw the number of cases per outbreak come down. And by and large, what it was they were doing the asymptomatic testing of individuals in congregate settings and finding 1 or maybe 2 cases, but no transmission within the facilities. And unfortunately, we've again started to see transmission. You can also see here the trends in terms of the newly reported cases reached within a day. And you can see that that has gone down for us from a public health system capacity perspective. We're down to 88% being reached within a day as of Friday, and the percent of newly identified close contacts reached within a day was down to 53% at the end of last week. And this is just, of course, due to the sheer volume of work for the COVID-19 essentially program that we have working on this at present. You'll recall we have about 200 staff who are reallocated to COVID, to work on COVID, and we've had additional staff that have been hired, both those that were granted by this council, the 75 FTEs, additional FTEs that were granted by the province as they added school nurses to the mix. And then we've actually had in the past week brought on board an additional approximately 15 FTEs that the province is in essence lending to us. So they are supervised and hired by the province, and they're working for us here in Hamilton, and they've given us, offered us 100% funding to hire about another 10 to 15 FTEs here in Hamilton to work on this as well. And so hiring people is a bit of a challenge. It takes some time, but we're on that. But the 15 that they have also given us have been very important to help us with capacity. You can go to the next slide, please, Steph. So the next one shows you the health system capacity framework indicators. And overall, these are numbers that are shared with us by our hospitals. They had been updating us each Friday, and they're going to update us a little bit more quickly. So our data is a little bit out of date for this week, but it will be updated later today for us. But they're sitting, as you can see, at around 96 to 98% capacity across St. Joe's and Hamilton Health Sciences. This is before their extra added COVID capacity that they have. This is just within their usual capacity. This is because, of course, they've restarted surgeries, they've restarted things that they were not able to do during the first wave. And so the good news is that people are getting things done. This isn't by and large driven by COVID. The number of COVID cases is actually still fairly low. But it is something we need to track, because if there were a surge in COVID cases, they would need to reduce surgeries, all of those sorts of things in order to care for those people who had COVID. In the ICU, we also sit at 70% at St. Joe's, 86% capacity, used up beds. So we do have some ICU capacity there. And of course, if there was a further increase in COVID cases, those would be quickly used up. Just to the next one then. So I'm going to just leave you there for the moment about talking about what red means and turn it over to Steph to talk more about the specifics around the cases. But that is the dashboard that the Hamilton COVID response table monitors, that Public Health Services leadership team monitors as we go through things. And then Steph provides more details, as she's going to do for you now.
Thank you. Stephanie?
Okay. Thank you very much, Dr. Richardson. So similar to my previous presentation last month, this presentation will be broken up, or at least this portion of the presentation that I'm going to give is going to be broken up into two parts again. First, an overview of case activity, and then followed up by an overview of outbreak activity. And once again, it's important to note that the information that I'm going to be talking about is current as of last Friday morning. Okay, so part one, case activity. So in previous Board of Health meetings, I went through the previous phases of COVID-19 here in Hamilton. So in wave one, the pre-peak period in March, during this phase, nearly all of our cases were travel related. It was during this time that we had our first case reported, our first outbreak commence, and the first case identified with no source determined. Furthermore, testing criteria were very strict. During the peak, that was between April to May, during this phase, there was a shift away from cases being due to travel and a shift towards people catching the virus from contact with other known cases of COVID-19. There was also an increase in outbreak activity, and near the end of May, outbreak activity calmed down and we began to see spread amongst younger individuals. The post-peak period, so from June to July, during this phase, we continued to see primarily cases that were due to people being in contact with other known cases of COVID-19. And we also saw an increase in cases with no known sources, or what we refer to as community acquired. Outbreak activity remained quite low, and only one outbreak commenced during this time. We progressed through the stages of provincial reopenings, and with that, we saw increases in socialization amongst Hamiltonians and also clusters in households. So now that we're in wave two of deemed phase 4, or this pre-peak period, so August through September, during this period, we continue to see cases primarily due to people being in contact with other known cases of COVID-19, and also cases with undetermined sources or community acquired. Also during this time, schools reopened and we saw our first cases identified in local schools. Socialization was also an issue and a key driver behind the increases in our case activity. Clusters continue to occur in households and also social groups. When looking at case statistics during this phase, we had a total of 274 cases reported to Hamilton Public Health, 1 death, and 10 cases hospitalized. Testing volumes have continued to be high, and with a total of 40,536 tests completed at the Hamilton assessment centers. So now being in phase 5, or the peak of wave 2, so between October to the 13th of November, during this phase, outbreak activity has risen sharply, which has contributed to the spread of COVID-19. A total of 46 COVID-19 outbreaks have commenced, including our first declared workplace outbreaks and our first declared outbreaks at local schools. Many cases during this period have also been due to contact with other known cases of COVID-19. It's important to note that these sources of disease do match what we saw during the peak of wave 1 as well. The spread of COVID-19 during the peak of wave 1 was also predominantly due to outbreaks in contact with other known cases of COVID-19. So when looking at the case statistics during this phase, we've had a total of 1,177 cases reported to Hamilton Public Health, 14 deaths, and 31 cases hospitalized. Furthermore, there have been a total of 37,272 tests completed at Hamilton assessment centers. So here, this map shows the rates of COVID-19 illness in Hamilton by census tract. And essentially, the darker the census tract, the higher the rate of illness. The East End has had higher rates of illness, which is shown by these darker blue census tracts. However, it's important to keep in mind that our rates are also being influenced by our outbreak activity, which I will touch upon in a few slides from now. So here I've created a graph just showing the percentage of cases by age separated by the 5 phases of COVID-19 that I've described on my earlier slide and that we've discussed now in a few of these Board of Health meetings. So when looking at the percentage of cases by age group during phase 5, so October 1st through November 13th, the largest proportion of cases has been amongst 20 to 29-year-olds, and the smallest proportion of cases have been amongst those aged 0 to 9 years old. During this phase, there has been an increase in those 80+ years of age. And this was determined by just comparing our data in phase 5 to those data in phase 4, where the largest proportion of cases was amongst 20 to 29-year-olds. However, the smallest proportion of cases was amongst those 80+ years of age. So here I've focused in on our cases just from phase 5, so from October 1st to November 13th. And this allows us to just take a closer look at changes in recent case activity. So this graph here displays the number of COVID-19 cases reported to Hamilton Public Health Services per day. Overall, case activity has been increasing since the end of the summer, really. So from August through September, case activity has been increasing in waves. So we saw increases between 1 to 5 new cases reported to public health per day. And then from the beginning of October until the present, so as shown in the graph here, the number of cases reported to public health per day has been steadily rising. So the number of cases reported to public health per day is now approximately 44 cases on average per day. Okay, so moving on to part 2, outbreak activity. So a total of 82 COVID-19 outbreaks have occurred to date. So that's from March all the way through to the 13th of November. The largest proportion, so 28 out of 82, so 34% of Hamilton's COVID-19 outbreaks have occurred in long-term care homes. The total case count in long-term care home outbreaks is also higher than all other facility types. There have been a total of 201 cases in long-term care home outbreaks. This is in comparison to 177 cases in retirement home outbreaks, 33 cases in hospitals, 35 in workplaces, 15 in emergency housing facilities, 12 in schools, and 85 cases in other facilities. So after going several months with few declared outbreaks, there has been a drastic increase in outbreak activity in what I've been referring to as phase 5, so October 1st through November 13th. There has been a total of 46 outbreaks during this period. The majority of recent outbreaks declared have been long-term care home and workplace outbreaks. And long-term care home outbreaks comprise the largest proportion of recent outbreak cases. There have been several notably large outbreaks which have occurred during this period as well. So one of which was the Spinco outbreak, which was declared on October 5th and declared over on October 26th. A total of 54 cases were identified with this outbreak. And the Chartwell Willow Grove outbreak was declared on October 22nd. And as of November 13th, there were a total of 62 cases. So now I will pass this back over to you, Dr. Richardson.
Great. Thanks, Steph. And you've got this next slide there too. So these control measures that are in place now as we're part of the red level, they came into effect, as I said, at November 16th today at 12:01 a.m. These are broader scale measures and restrictions across multiple sectors to control transmission. And so very much the framework is trying to balance the need for controls to reduce spread while also trying to allow for people to be able to go to school. Keeping our kids in school is one of the greatest priorities, allowing for people to be able to work, but further, confirming that we want people to be working from home. We want to make sure that all the control measures are in place. And in some cases, unfortunately, having to reduce for some businesses some of their activity in order to reduce the likelihood of transmission. There are gathering limits now, of course, for all organized public events and social gatherings that are reduced to a lower level. And as well, our colleagues in MLE are working very hard to support the efforts to keep these measures in place. Dr. Harvey has a saying that he uses often that is about how the virus has not changed. It is what we are doing that has made the change. And what we do see, as Steph has said, when we're reviewing cases, when we're going through things, we are finding that people aren't following all the public health measures that they need to. It may be that the masks are off while people are going out together for lunch, or it may be that they're carpooling and not following all of the things that need to be followed while they're carpooling. So it's various things like that, or cases where they're going out and socializing with a group of friends, and then you can see the spread from group to group. So it is very much what we're all choosing to do that is causing the increased rates in cases. It's nothing that's changed about the virus. We know with people coming back indoors, yes, there are more opportunities for people to be closer together and that sort of thing, but that's why these measures are so very important as we go forward. Next slide, please, Steph. So you may be saying, okay, so when are we going to be able to get back to something that's a little bit more normal? And is an immunity strategy or a vaccination strategy something that will help us get there? And we do wonder if in part the announcements around a new vaccine are having people feel a little bit like, okay, it's not so bad, it's coming, and maybe feeding the complacency perhaps to some extent. But in fact, it's the opposite, in that we really need to continue the control measures until we get to a vaccination plan. And that vaccination plan, while the first doses are anticipated to be available in the first quarter of 2021, according to our conversations with the province and our federal colleagues, that is very much going to be a limited supply. And the vaccination program will, if the vaccine continues to be found to be effective, will continue to roll out through 2021 and 2022. So it's very clear that vaccine access is absolutely going to have to be prioritized. And there's already federal and provincial guidance, federal guidance at least from the National Advisory Committee on Immunization that they put out, I believe it was in May, about how to prioritize vaccine use so that those that are most vulnerable will have the earliest access to the vaccine. Here in Hamilton, we do have our own vaccine program staff, of course, who are very much part of the planning locally, but we've also drawn together under the Hamilton COVID response table, which brings in the hospitals, long-term care, primary care, mental health. Everybody is there at the table. There's a subgroup or a working group of that committee that is working on specifically immunization vaccination. And so we had our first meetings with the province this past week. Now that they'd had enough information, they'd gotten information together as to what was likely to be required. And so Michelle and Nin have been attending that meeting and will continue to attend those. And they're just ramping up. Okay, what does this really look like here in terms of who's going to deliver the vaccine? How is it going to be distributed? Where is it going to be stored? Because as you've heard, there are significant issues with this new vaccine in terms of storage and those sorts of things. So logistics are going to be a significant area for us as we move forward. Next slide, please, Steph. In terms of our own COVID-19 work, so even with all of the people that you heard me speak to working on COVID-19, I can tell you it is incredibly busy, the work that is being done. And this weekend was absolutely no exception to that. We work on a 7-day-a-week basis, again, as we did in the first wave. And so that requires more staffing resources than working on a 5-day-a-week basis, of course. And then there are just the sheer volume of cases. Contacts is a huge contributor. Outbreaks are a major contributor to workload. And then just in general, trying to work with our community and understanding which level we're at and what controls they can put in place. We did in speaking with on the Hamilton COVID response table, we have had the Chamber of Commerce and our BIAs join the infection prevention and control groups, and they have been speaking to how they need some support to really understand all the guidance and the changes and what it means for them. Safety plans are now part of what businesses are often required to do as part of the provincial framework, but larger companies will have access to occupational health and safety people who can help them to create that. Smaller business does not. So Dr. Doug Sider, who's been back working with us through this second wave, he's working with the Chamber and others to help to support business as they go forward to understand what they're doing. So that's just an example of all the fronts that we're working on. So we did prioritize our work because we do have this other work, inspecting the restaurants, working with childcare settings, all the very important work that has to go on with schools in terms of child mental health and supporting that, our own addictions programs run through ADGS, as well as the work we're doing on harm reduction and opioids, the work we're doing with new moms and families around healthy babies, healthy children. There's a whole slew of regular public health work that has to continue. And so we had reached the point where there really was, if we're looking at this in from a long-term perspective of the next year or two, we really couldn't take any further resources from that essential business on the usual public health services side. And so we had to say, we have to prioritize within our COVID resources if we continue to have large case numbers, large outbreaks, how will we decide what gets done? And so you've heard Toronto speak to this. They're the ones that have been the hardest hit in terms of having to limit the degree to which they could do work on COVID-19, and other health units, of course, have been going through the same sort of thinking. But this is the framework that was developed by Jordan Walker, who's our COVID senior manager, and Michelle, and reviewed by our leadership team, and essentially lays out, what is the essential work that if everything was very, very high, this would need to be done through what is the lowest. And you can see referrals for research trials, which we do help to support because we know just how important they are in helping us to move forward in understanding COVID-19. So that's our lowest. So we would stop doing that first. Then we move into the medium risk stuff. And so if we had to, we would stop doing contact management in lower risk settings. We would stop doing the monitoring of cases in close contacts. So that's where we're calling them every day, but rather we would say to the people who have lower risk contacts, let them know yourselves. And we would say to those that are cases and contacts, give us a call if you run into challenges. We would not do our general inquiries. We would stop doing release letters for cases, really something they don't need overall, but some employers or others may be requiring. And then our reoccurring school visits, as opposed to the ones that we've gone through, we've done a whole assessment, given them the information. We would still be there as a resource, but we wouldn't be going back in. So we said, essentially, if we got to the point where we'd stopped all that and we were still overwhelmed, then we would go back into those other services and say, for a short period of time, could we take some more staff away from that work and help with COVID-19 if we found we were getting to the highest and essential types of service in terms of supporting COVID overall. So just wanted to share that framework with you, just to let you know. We have indeed gone to the point where at times we've had to say to people that please let your contacts know, even in the high risk group, let your contacts know to self-isolate, to not go out, take all these measures. If you're sick, call, because we're not going to get to them for a couple of days. So you can see where we've dropped in terms of being able to get to our contacts within, only being able to get to 53% of our contacts within a day. That's what we're asking them. Tell them to self-isolate, tell them to get tested if they're sick, and we'll be calling them within a day or two. Unfortunately, there are health units in the province who are well beyond that in terms of their ability to follow up, not just with contacts, but also with cases. So that's the framework we're using there. And just next slide, Steph. That's all of it from us today. So I'm sure you'll probably have some questions about what it means to be in red and all of these things, and happy to take them.
Thank you very much, Doctor and Stephanie, for that detailed information. And just a quick question on my part: are the stats that we're showing based on 100K, 100,000, or on the new threshold that we're talking about that the Premier actually adjusted over the weekend?
So we give you two sets of stats. We'd give you the daily case count. And so that's where Steph is saying, you know, we've been sitting around the 40 cases per day. And unfortunately, they're very close because of the population of Hamilton. So that sits at about 40 cases per day over the last few days. On the cases per 100,000 per week, that's the indicator that is being monitored by us and by the province in terms of judging the overall progression of the outbreak. And on that one, we sit at about 50 cases per 100,000 population on a weekly basis.
Okay, great, thank you. Speakers list, questions. Councillor Farr.
Thanks, Mr. Mayor, and thank you for these updates. And our first in the red zone, I guess. Yesterday, you, Mr. Mayor, and I received some correspondence from a very popular downtown restaurant and bar in our core, a facility that's approximately 5,000 square feet. The owner, understandably, is distraught, like so many business owners, restaurant or otherwise, in the city and across the world. But their 30-plus staff are not working. Their income, they claim, is down $300,000, $50,000 a month and climbing. Mr. Mayor, thank you. You got ahead of me and offered some very sound responses on a few occasions, and even ordered takeout many times, as you said in one of the responses from this restaurant. The owner is very grateful, still very worried. It was some good correspondence, and both Paul and Dr. Richardson are being requested to reach out specifically, and I'm sure when they find the time they will. There were a couple of questions, though, and so when we tackled the issues related to this one industry, which is 30,000 strong, working in the bar and restaurant industry in Hamilton. In the first wave, we were ahead of all other municipalities. We hit the ground running on outdoor dining with a local effort to assist. It was adopted everywhere else. Our staff partnered with owners and BIAs, saw approximately 165 businesses sign on and have patios where they otherwise didn't. We had several subsequent motions that included extending the patio program through winter next year, but the reality is, of course, outdoor dining not going to take off like it did this past summer and spring and fall. It's better when the weather cooperates. So again, I know our staff are going to be reaching out directly, but I thought it was timely that we bring up a few of the questions that they have. I'm simply transcribing those questions here and hope for some brief responses on these three. So the first one pretty much was asking, why do all restaurants have the same restrictions with respect to the number of patrons, regardless of their size, their ceiling heights, their ventilation? Specifically, why didn't we factor in those numbers based on square footage, a square footage matrix at the very least? And this is what the owner said, quote,
Can we deal with them one at a time and get an answer?
This is what the owner said to this first question.
Yep.
Quote, does it seem right to you that all restaurants, regardless of size, ceiling height, ventilation, capacity limits, etc., be limited to the same limit of 10 people? Does it make sense that a 5,000 square foot restaurant be limited to the same capacity as a 500 square foot restaurant? End quote. Through you, Mr. Mayor.
Thank you.
Through you, Mr. Mayor, I can completely appreciate the frustration. I think our restaurant industry, in particular, our hospitality industry in particular, has really borne the brunt of a lot of what we've experienced. And as you've heard me say before, I have a son who works in the industry, and it's been tough. Unfortunately, it's sent him back to school, which is not a bad thing. But yeah, it's certainly been very difficult. The challenge, I think, has been to find those thresholds on a per 100-meter basis and define those. I haven't seen those anywhere in any of our, and by our, I mean Ontario's documentation, and I'm not aware of that having been done elsewhere in Canada. I'll turn to Kevin and Bart and our others to see if they're aware of any. At this point, in essence, what it's been is saying, you know, we need to just reduce volumes in these places where either we know people are together and can tend to be closer together. We know that they're going to have higher risk pieces like having a mask off while they're eating or drinking, and so that places it overall at a higher risk level. And as well, we definitely have seen in Ontario disease outbreaks that have related to restaurants. There was one that I'm sure you heard about that happened at the end of last week in Waterloo. And while we here in Hamilton haven't seen a lot of that, what we've seen has been where there have been outbreaks, it's basically been in staff-to-staff transmission. It's not been amongst patrons. It's absolutely clear that we've been pretty lucky. And there have seen those other large-scale outbreaks related to premises elsewhere. So I think as we go forward and we try to get more refinement and make changes, that may come. But at this point, we just don't have that science to tell us that. And I'll just ask Bart or any of the others if they have anything to add.
I don't. It's possible. It's possible that Nin does. He probably is. But I'm not aware of that level of detail being explored.
Okay, thank you. This is Dr. Tran on the call.
Yes, he is now.
Okay.
So, Mr. Mayor, I'll just repeat the question. Why do all restaurants have the same restrictions with respect to the number of patrons, regardless of size, ceiling heights, ventilation? Specifically, why didn't we factor in those numbers based on square footage matrix, as an example?
Understood. Thank
so,
you.
Nin, just if you have anything to add that's different from what's already said.
That is 5 minutes, Councillor Farr. So I'm gonna put you back on for any additional questions. Thanks.
That's fine.
Dr. Tran?
Through you, Ms. Mayor, I don't have anything to add to what Dr. Richardson and Dr. Harvey has mentioned.
Okay. So it's an outstanding question. I know that the doctor and Paul and others will be trying to answer that particular questioner as well. And, and we do need to remind ourselves that these are now provincial minimum requirements from them. And obviously we can go higher if we so choose, Doctor, correct? As they are in Toronto that decided to do a full shutdown.
So through you, Mr. Mayor, or to you, Mr. Mayor, that it is very much, these are set by the province. They are not set by us in terms of what the requirements are. We could become stricter. We could say, no, we think the restaurants should close altogether, but we could not reduce that further.
Correct. Thank you.
Increase the number of people, I guess it would be.
Right. All right. Councillor Partridge, you're up next.
Yes, thank you, Mr. Mayor. And first of all, I just want to say thank you so much for all the work that everyone has been doing up to this point. With regards to the 5 minutes, the questions I have to ask, I'm going to ask staff if you could please really tighten up your answers so that I get a chance to ask all my questions. The first one is I'll direct to Dr. Elizabeth. With regards to a media release on the code red, did I miss one? Was there a media release issued to go out to the community on what exactly is it entails?
Through you, Mr. Mayor, I believe you mean on the red level as opposed to code red. And there was a press conference that was held on Friday, and we went through some of it. The province was still issuing their regs, and
do we have a media release from the city that I could send out to my businesses, because they are really panicking out there, as they are in all wards. Okay. Is there a media release?
Go ahead, Doctor.
There's no media release. The best thing as always is to go to our website.
Oh, thank you very much. Okay, are we planning to do a media release from the mayor's office, or?
We're doing a media availability this afternoon at 4 o'clock, I believe. Okay. All media, and that's YouTube, Cable 14, and 900 CHML will all be broadcasting that media briefing.
Yes, thank you, Mr. Mayor. I did see that. Dr. Richardson, the other thing, you made a comment from one of our associate medical officers saying that the virus isn't changing, that it's our behavior and what we're doing. I'm going to challenge that a bit, because what I'm hearing and what others have been hearing from our federal Dr. Teresa Tam, is that the virus keeps changing. So I don't disagree with you that our behavior needs to tighten up, but I'm concerned about the message going out that says the virus isn't changing, because I'm hearing from the World Health Organization and from others that indeed this virus is very difficult because it does keep changing. What are your comments on that, please?
Through you, Mr. Mayor, I think primarily what we're talking about is the general understanding we continue to grow. Absolutely. There is every virus changes a little bit all the time, but the main things about how this virus spreads are not changing, and that the main things we need to do to control it are not changing. And so that's why we can continue to do the same things while we continue to learn a little bit more about what else we can do, but the mainstays are absolutely the same.
And thank you. I don't disagree with that, but I am concerned about some mixed messaging that you know, we're hearing from different levels. And I mean, we're all getting the emails from not only residents, but particularly from businesses who are extremely concerned. And you know, I even had one on the weekend that said, you folks aren't taking it seriously enough, you know, when in your discussions at committee meetings. So people are really hurting, and there are businesses that are going to go out of business. And it's really a concern. I just want to touch on slide number 10. If I was reading that correctly, around Waterdown and Ward 15, it looked like we were over the 300 plus number of cases. And that was, I believe, per 100,000. So with the population of Waterdown being 30,000, what does that equate to?
Steph, can you speak to that, please?
Sure. So, sorry, that would equate to between 300 to 380 cases per 100,000. It's just standardized to the population size.
No, I understand that. My question is, with the population of Waterdown only being 30,000, what number of cases are there?
Sorry, that would just be divided. That would just be if there were 100,000 cases, that would be per 100,000. So you would just
So basically a third of that. Is that
Correct.
an accurate assessment?
Correct.
To do a third, so that would be around 100 cases.
It would depend. It's a range, so I wouldn't be able to give you an exact number.
Okay, and that's fair. I just, you know, for people who are looking at those maps, that it is very confusing. But thank you. I do appreciate the answers. Thank you, Mr. Mayor.
Okay, thank you. I have Councillor Wilson.
Thank you, Mr. Mayor. Thank you, Dr. Richardson, Dr. Tran, for all that you're doing and the exhausting hours that you're putting in and to your team. I was just wondering if you could describe the decision-making infrastructure that is used between a local public health and the provincial decision-making. I've been asked that a couple of times of where are they getting their information. Could you describe that a little bit, if you don't mind, and your role in it?
Through you, Mr. Mayor. So the province has its own decision-making structure about dealing with the pandemic. So they have a command table. They have different groups that are focused on different issues. They have a public health measures table that's advising around the control measures that we've just talked about. They have Public Health Ontario that's helping with expert advice. There's a whole structure that they have in terms of making decisions there. They do, the Public Health Measures Table does have representatives from local health units on it. And as well, when they're making decisions about moving between levels, they do come and consult with us to ask if we agree, you know, with where we're going or if we have input around what's going on in our particular health unit. So that's you know, one of many conversations that we have with them, but from a decision-making structure, that's the decision-making structure. At the same time, locally, we in Public Health Services have a combined management command table that looks at local decisions that we are making, and we do that in conjunction with the Hamilton COVID response table, which brings together all the health system partners to look at and share information.
Okay, that's helpful. Back to the, if you don't mind, through you, Mr. Mayor, the Public Health Measures Table. You're saying that you do sit on that, or there is representation from our unit on that?
Through you, Mr. Mayor, there's representation from local public health across the province. There are 6 members from the health units across the province.
Okay. I had just read something and I guess it's misinformed. It said that no local medical officer of health or public health staff reports to the government from that table, and that if you are a party to that table, you have to sign a NDA.
Through you, Mr. Mayor, there are certainly representatives on it. As to what their processes are, I'm not aware.
Okay, thank you. And so I don't want to put you in a difficult spot, but you feel satisfied with that the information is getting up and through these tables.
Through you, Mr. Mayor, there's no doubt that we all want to be part of discussions and information sharing, and there are many venues to do that. I was meeting all weekend long with my colleagues across the Greater Hamilton and Toronto area, talking about, what are the issues, what do we see? Like, we're all getting together to share information, to understand it, and to provide information through the representatives that are there. So, I don't know that we could do anything much better, but I can't speak to the processes that go on beyond that.
Mm-hmm. Thank you. If I could just thank you one more question, seek clarity. I think you had mentioned that Dr. Tran was sitting at a table, the purpose of which was to inform the vaccine rollout strategy. Did I hear that correctly?
Through you, Mr. Mayor, yes. Michelle Baird and Dr. Tran are on the vaccine group.
Okay. And so that would be the table in which sort of local circumstances and need, I'm trusting there have to be some uniformity, but can you speculate on the role of any regional variance to inform a vaccine rollout?
Through you, Mr. Mayor, the strategy will be set by the province in terms of vaccine rollout. To the degree to which that would vary with we've had the experience with H1N1 before, we have the experience with every vaccination program that we run. Yeah. The degree of local variability is very, very small. It's consistently applied across the province.
Okay, thank you. Thank you. Those are my questions. Again, thank you very much, Dr. Richardson.
Thank you. Councillor Nan.
Thank you, through the mayor. A few questions to staff. Thank you, Dr. Richardson, and all the other staff who've given information in this update. Picking up on the vaccine rollout plan, which I have to say many people probably following along today are feeling some sigh of relief in the sense that something is coming. Though I heard very clearly you stating that the need to stay vigilant in following our public health protocols is that much more essential in order to make sure that we're maintaining the spread in order to implement a rollout plan. But a couple of questions on the rollout as it will come up from constituents and residents across the city, and understanding that the province kind of regulates that rollout and will have some input through our both Michelle and Dr. Tran. But what can we anticipate in terms of target populations for that rollout? Would we see a rollout that has medical staff and frontline emergency responders upfronted, long-term care facilities upfronted, teachers and students upfronted, and then more of a general public rollout? Is there a sense of any of that you can shed light on, whether through the H1N1 experience or anything that we can anticipate, recognizing that this work is still underway?
Doctor.
Through you, Mr. Mayor, I'm going to turn to Michelle or Nin and just to speak to the NACI, the National Advisory Committee on Immunization, what their recommendations have been and where the province, what we might know from the province so far.
Thank you.
Thank you. Michelle?
Yes, through you, Mr. Mayor. Thank you for the question, councillors. I would say this work is just underway. So the NACI guidelines were developed and come out earlier this year, really looking at how vaccine is prioritized, giving consideration, of course, to those most at risk of complications. So we might think of the elderly or others in that category. Then looking at those folks necessary to continue essential services, of course. So in that bucket, we might see people, our frontline staff, grocery store workers, obviously healthcare workers, then also including groups that are most at risk of acquiring COVID. For example, people that live in congregate settings, people who's, living in close communities, and the Indigenous population is included within that bucket. And so really that these groups were the ones that they prioritized, but recognizing that all of this work was done before the vaccine was available and at a time, obviously, before we know the level of COVID transmission at the time when the vaccine comes out. So it was noted that these are very preliminary and, of course, subject to change and be modified along the way. The other piece is looking at how much vaccine is actually available will play into, of course, who receives vaccine.
Thank you. Dr. Tran, anything to add?
Just to echo Michelle's point and the fact that it's the prioritization will be further scaled based on supply. So within those three priorities areas, if the supply is limited, there might be priorities within that. For example, those with existing medical conditions that make complications much worse.
Thank you.
I appreciate that. That's really helpful and helps contextualize the rollout plan. And I also saw on that slide that the kind of timeline for general vaccination is 2021 through 2022. So that understanding about the fact that this is a global pandemic, the supply is going to be globally managed. And so from that perspective, it's really hard for us to get a sense of anticipating when Gen Pop will get the vaccine, and it's all going to be related to supply. But having said that, we're applying a health equity lens, or that we anticipate the province and the federal government applying a health equity lens and then an essential service lens in terms of rollout.
Yes.
Excellent.
100% right.
And if I could add, Mr. Mayor, just while we'll have that overarching prioritization, there's also the way in how we do it locally in terms of how we make things accessible, how we, who gets it to whom, how, that is also something we can decide locally.
Oh, excellent. Okay. Thank you for that. And then just a general question in terms of our ongoing maintenance, in terms of our rigor around testing, tracing, and isolation programs. Where are we at, Dr. Richardson, in terms of our systemic stability? Yeah, that's it for now.
Okay, thank you.
Through you, Mr. Mayor, were you speaking specifically about testing? Sorry, Councillor.
Testing, tracing, and isolation. Mm-hmm.
So I'll go sort of through those in a different order. So in terms of tracing, you saw our updates around contact tracing. We're pushed around that, and we're hopeful with the new resources we will catch back up on that. But ultimately, it's a challenge, and that's why we have that prioritization. We've developed alternate methods in order to do it if we're not able to continue to do so. On the testing front, we were keeping up pretty well. I'm going to ask Michelle where those sort of sat over the weekend in terms of testing.
Michelle Baird.
Yes, through you, Mr. Mayor. I actually don't have the answer to that question, Elizabeth, with respect to where we sat over the weekend, but certainly we can follow up with that, Councillor.
Yeah.
Okay. And then generally speaking, in terms of our testing capacity citywide, that we control locally, just generally wanting to get a sense of where we're at in terms of being able to maintain the rigor of our testing. I noticed in the stats in the pre-peak and current peak period that we're in, there's a reduction in the number of tests, and I was just curious about that being number of people going in for tests, or is there less testing available?
Okay,
Through you.
Doctor.
Through you, Mr. Mayor. So we do continue to have the assessment centers that are available. We made the change from the arena over to the new mountain site, and that is available to us. There was a large change in testing volumes when we went and when the province went to change the criteria for testing and had the asymptomatic testing was no longer allowed to go through that route, but could go through the pharmacies. So that accounted for a large amount of the change that happened there. We'll be getting updated stats from our colleagues in the next 24 hours around testing and have a sense of where that sits overall. Otherwise, what we're left with is what we generally find when we're talking to people and getting test results, but it's better for us to get the actual stats, as Michelle says.
Fair enough.
Right.
Much appreciated. Thank you.
Thank you very much. Councillor Jackson.
Thanks, Mr. Mayor. As a former small business owner of 2 Second Cup stores years ago, I'm going to be blunt and say that this is a very sad day from my standpoint. I'll get to a couple of questions to Dr. Richardson. I've already heard from 3 establishments
restaurateurs in my ward over the weekend, very angry, very upset. They're in total compliance for these last 6 to 8 months. They've done everything to try to survive. Clipboards, checking in with people, mask shields, limiting the numbers, outdoor patios. And in light of the new regulation that the Ford government announced, very unhappy and not sure where their business future will go. So I need to understand, Dr. Richardson, what has changed in the last 96 hours is that the threshold of 100 per 100,000 changed to 40 per 100,000, which suddenly put Hamilton into the red zone from the previous yellow zone. Correct? Through you, Mr. Mayor?
Through you, Mr. Mayor, that is correct. That is the change that happened at the red level, but there are changes throughout the framework and on other indicators as well. And so there was a lot of concern, sorry, there was a lot of concern that the indicators, the thresholds that have been put out were not stringent enough to bring about the degree of control that was necessary to not end up in the kind of position that, you know, our neighbors to the south have been.
Thanks, Doctor. You know, Mr. Mayor, we're not Peel, we're not Toronto. I am, and you know, Mr. Mayor, I have faithfully followed the regulations, done it by example, my mask, social distancing, on-site appointments I've had with constituents these 8 months, following all the rules, encouraging others. And I'm telling you, this is the first time on behalf of many small business owners, I'm very sad at the announcement going from the 100 to the 40, which put our 52 per 100,000 now in the red category. And I'm going to reference the end zone. Greg Korpanicki, who was on this morning on Channel 11, exactly the situation with his large establishment. I get his anger and frustration, and those are similar to the 3 restaurateurs I heard from. Anyways, Mr. Mayor, I'm thankful. I've got an MP on the mountain, Scott Devell, who's working with my office to hopefully help my 3 restaurateurs apply for the federal subsidy in the program. Thank you, Mr. Mayor. Thanks, Dr. Richardson.
Okay, thank you. Councillor Clark.
Am I on, sir?
You are.
Thank you. 2 very quick questions, I hope. This report talks about the hospitals being at 96 and 98% occupancy for funded beds. It talks about the ICU bed being at 70 and 86% occupancy for funded beds. Those numbers concern me. Can I ask Dr. Richardson, are the hospitals creating unfunded beds, and that's why we included the term funded in this report?
Through you, Mr. Mayor, that is that distinction that I was outlining for you, that there's additional capacity that has been created for COVID should they need it. You remember that was a huge focus of wave 1, was to actually expand overall hospital capacity. And so we're just focusing on their usual funded capacity and not the extra capacity that they've created and where they're at. So that is the measure that the province uses, is how full are they there, and would they have to move into this additional capacity?
So in Burlington, they built a special tent or something like that. It was outside for surge capacity. Where is the surge capacity within our hospitals in Hamilton, Dr. Richardson?
Through you, Mr. Mayor, there is surge capacity that they planned for that is within, there's the term they use for the space, but space that's used for other things, essentially. And so, space
not closets, right?
Well, I won't even begin to go there. But
I only say that because I was in one once, so it's okay. Yeah, I understand.
Imagine. But the PRU, as it's called, that other space in Brant is also something that would be available to the broader region, not only to Burlington. Sorry, not in Brant, but at Joseph Brant. That would be available to a broader region should it be necessary. But there is additional capacity that's been contemplated within the hospitals. And then, of course, you know that the hospital had approved some additional extramural outside hospital capacity for other chronic patients.
So are the hospitals in regular contact with you to assess the trends, because the trends do not look good. They're exponentially increasing, not trending down.
Through you, Mr. Mayor, one of the reasons I wanted to show you that dashboard and those indicators this morning is so that you had a sense of what we look at all together at the Hamilton COVID response table, which is co-chaired by myself, Melissa Farrell from St. Joseph's Hospital, and Scott Wooder from Primary Care, but then has members from across all of the hospitals, all of the healthcare partners. And so we review that all together. The hospitals contribute in the data and we look at it. And absolutely, we're all concerned about it. The challenge is that we're also very concerned about all the other people with heart disease and cancer and surgeries that need to be done. And so, really wanting to see them be as close as they can to their limits so that they can get all the things done that need to be done.
And the last question, Mr. Mayor, it's on page 10 of the PowerPoint presentation. I'm trying to understand, I'm not a statistician, so I'm trying to understand this report. It looks like the area that is Upper Stony Creek is showing 532 to 3,084 cases.
Through you, Mr. Mayor, I'm thinking we need to go back and take a look at another crack at this map and how we can display it so it's most easily understood with the question from yourself and Councillor Partridge. Essentially what it means is it's giving you a rate per 100,000, so you can have a standardized rate rather than a number in your area. But then of course you need to know the population of the area to sort of interpret how many cases are there. So overall, yes, you can see because it's at a darker shade, there are a higher number of cases there. Part of that again is as I said, related to the size of the population, but there hasn't been a very clear trend in Hamilton around where it's located geographically.
Yeah, it's an odd one because when I'm looking at that one, that if I'm reading it right, it looks like it's Ward 9 going to the Grimsby town line and it's painted dark, and that large rectangle there to the right of the chart is the lowest population in Ward 9. And then beside it is the suburban area. So I'm trying to understand, clearly this map is telling me that there is a larger impact of COVID-19 in my general vicinity, but we really don't know the exact numbers for that area. Is that what I'm to take from this?
Through you, Mr. Mayor, I think this is the piece where we were asked to come back and show the map as part of this so people could see where it was dispersed. Our general impression has been it doesn't have a geographic relationship. When we look at it by in terms of where it's happening in our city, when we look at it by the determinants of health, there is some influence of the determinants of health in terms of where it's happening, i.e. those that are do more poorly on the determinants tend to have higher rates, but it's not as clear-cut as it is, for example, in some parts of Toronto. So we were asked to show it, but we don't, it doesn't give us a lot of information in terms of plan and control measures.
And with regards to restaurants, do you have access to any reports that you could share with the council in terms of a study on the spread of a virus like this, COVID-19, in a restaurant setting? I'm thinking people coughing, people chewing. Is there a higher risk of spreading COVID-19 in that type of setting?
Through you, Mr. Mayor, there is a general document that outlines the risk factors for what increases the risk of spread. There's a few of those that have been generated by different organizations. I can't think of anything specific to restaurants, but you can definitely look at, okay, what factors there contribute to higher risk to them being more of a moderate plus risk setting. But I'm going to turn to Dr. Tran because he's been doing more of the infection control piece on it to see if he has anything else in particular.
Thank you, Doctor.
So through you, Mr. Mayor, I'm not aware of a specific research document on restaurants specifically. Dr. Richardson mentioned there's documents that give higher risk levels, but in terms of some of the principles why it might happen more in restaurants, one is while you're eating, you're not wearing a mask. That happens. And I think the other part is that when you're sitting at a table with others, I mean, generally, within that table, they're not spaced out within the table to have physical distancing. But I'll look to see if I can find anything more specific on restaurants in general.
Thank you. Councillor Clark.
It's not urgent, Mr. Mayor, but it'd be interesting to see any of those studies that would support why the province made this type of decision, because they're sharing their decision. They're not sharing the data that informs their decision. And that's kind of the challenge that we're having when we're talking to restaurateurs. Thank you, sir.
Thank you. Councillor Pauls.
Thank you. Dr. Richardson, you mentioned that that the residents' attitude has changed towards COVID, and that's why maybe we're seeing an increase. I feel part of it is miscommunication, and the reason is this. On the weekend, I had lots of phone calls. Even my family called me and said, what does the red mean? We know that yellow was 10 indoor, 25 outdoors. But what does household only stand for? So they phone me, can we not leave our own household? Like, can I have company over? That's maybe 10, social distancing indoors. So there is a little confusion. Can you explain what the red means, household only?
Through you, Mr. Mayor, and I think there are distinctions between what the advice is and what people are going to be enforced for, and that may be leading to some of the challenges. But let me be clear what the advice is, and this advice has been in place for some time now, as we've been looking at the numbers. It is that you only spend time in close contact, that means no mask, within 6 feet of your household members, and that essentially you should keep only to your household. You should not be going out and socializing. You shouldn't be having people come into your house to socialize. If you need to have a tutor, that we talk about essential support, so a tutor, a babysitter, so you can go to work, anything like that, you could have come into the household. But other trips outside of the home should only also be for essential purposes. So you need to go shopping for your groceries, you need to get your car fixed, those sorts of things. And so I appreciate, as things have gone on, this concept of the social bubble was certainly one that was tried in the summertime. But essentially, as we saw the case numbers start to rise, we've said it's not working. It may have worked to then, it's not working now. And so we need to keep to our household contacts.
So therefore, the bubble wasn't working anymore. So now, let's say my family, for instance, my children, I have 4 sons. I want to see my grandchildren. I cannot allow my son with my 3 grandchildren to come and see me, even though I've seen them constantly for the last, bubble session when we were in yellow. So is that what it means now? We cannot have family over.
Through you, Mr. Mayor, in terms of the advice, if we're living separately in separate households already, then the advice would be no, they shouldn't be coming over and spending time at the house.
Even though we already have spent time together, right?
Through you, Mr. Mayor, because the situation has changed and the rising number of cases, that would no longer be advised.
Okay, so that's what has changed from yellow to red. Is that right? Because before a Monday, before today, we could. I just want to be clear because people are calling me and they are confused.
Through you, Mr. Mayor, before Monday, the advice was already to stop doing that. The advice has been for a couple of weeks to stop doing that. And it's not that the level has changed because the number of cases and the number of outbreaks has changed. So that has been changing, and that's why the advice was changed last week, and that's why that advice is also there under red.
So what does 10 indoor mean then?
There is still, through you, Mr. Mayor, some recognition that there may be circumstances in which people would want to get together. I understand this is one of the most controversial parts of the framework, is why is that still there if what we're advising is that not be there? And I appreciate that's challenging and difficult. I think that's some of the things that there are always going to be parts of this framework where I think we can do CQI and be clear about as a province. That's being worked on by my colleagues at that level. In the meantime, my job is to say the best advice we have, and it's consistent with the best advice of the chief MOH, don't do it. And I will say, Mr. Mayor, and I'm not saying at all, Councillor Pauls, that you're doing this, but I do think we have to find as much as possible ways that we can do the greatest extent of control possible, rather than looking for a way that maybe we could not do that. And again, Councillor Pauls, I'm not at all saying that you're doing that. I'm just saying in general, that's what we need to do.
And the problem I find, it is an advice. When it is advice, it's not, you know, people say, oh, okay, I did it before, I'm going to do it again because it was advice. And you yourself know if you're safe, if you're not testified, if you feel good. So that's the problem when it is an advice. And I had people calling me saying, should I have a little party, not a party, but a couple over for dinner for the last time? And they didn't understand what it really meant. And to tell you the truth, I read it and I didn't understand it. Where it's 10 people indoors and yet 25 people outdoor, and yet we cannot have a family member over. So that was the confusion. And I really appreciate it. But I had lots of calls about like our city closing now pools and sports. And they're saying, if a private sport books a facility from the city, can they, let's say a pool, a swim team books the facility, can they do the swimming? Because I just saw that sports are going to be closed down. Is that true?
Through you, Mr. Mayor, this is another thing that's a bit challenging about the framework is that we all use sport, team, activity, exercise, fitness. We use them to describe a range of activities and don't necessarily apply the same thing to you know, in the same way. So to be clear, teams can't play games anymore. Done. Right. Teams can practice.
Okay.
That can happen. We can still have facilities open. You can still have fitness facilities open and have fitness classes, 10 people per room, all the new caveats that came with the province. Our guidance has now been taken down and we're going with the province's guidance. You can still have activities in those rec centers. They're going to be well managed, well, I can tell you, by our rec staff as they go forward. So there will be some things available to people that are keeping within the guidance of less than 50 people in those rec facilities. So absolutely, there is some of that available.
Okay, I really appreciate it. I have one last question. And you understand why people are calling and we have to give them an answer. So we appreciate your help. We really do. But my last question is, when someone is not feeling good and has COVID and goes to the hospital, what is the extended stay? What is the max stay that they usually stay in the hospital? Is it a couple of days, 1 day?
Through you, Mr. Mayor. So you mean if somebody's actually admitted into hospital because they're that sick?
How?
That's actually come down of late. The latest ones have been shorter, but Stephanie, I'm not sure if you have that.
Through you, Mr. Mayor. Sorry, Dr. Richardson, I actually don't have that. We do have data on length of stay, duration of stay of hospitalizations, but I don't have that on me right now.
It'd be interesting to know how long people usually stay in the hospital when they contact and the results, of course, what has happened. So it would be interesting to know that. I appreciate all your help. Thank you.
Thank you. Councillor Danko.
Thank you, Mr. Mayor. Just to pick up on Councillor Paul's point on recreation programming, maybe we could ask Director Paul Johnson just to elaborate a little bit specifically on indoor swimming in the pools and also on the hockey season. I was at the rink on Sunday and, you know, the hockey season's just getting underway. So this is going to impact, you know, quite a few kids throughout the city.
Okay, Paul, are you on the call? There you are. Go ahead.
I am, and through the mayor, absolutely. I mean, hockey is shut down in terms of what it's been doing recently. There can be training, and of course in facilities now, and that means that if there are 2 pads or 4 pads, it's 50 in the entire facility. So you can't have 50, 50, 50, 50. It's 50 in the entire facility. But the reality is, why you'd be bringing that many hockey players together at this stage when you can only train is. It's probably a question answered by we won't be. So hockey is certainly going to take a step back. It's going to not involve any of the scrimmages or little games that were being played, and it's going to be that training only piece. Some of our pool pieces will be open and will continue to be, and we are canceling some things. So today people will wake up and they will be receiving information that things like our swimming lessons and our registered programs, things like pickleball and badminton and basketball and the open gym and water fit and things like that are going to be canceled. We are going to have some limited programs go through this next period, and those will come out as our folks in recreation get a handle on what it's going to mean. But the numbers are so small now. Yes, we could have up to 50 people in a pool area. So we do expect there will be some pieces of that, but they're going to be very limited for the next little while to small activities of recreation and exercise. And I think more people are going to have to find individual ways to keep up their exercise routine, to keep active, much more in line with where we were in the spring for this next period of time. So I know it's disappointing, and there will be disappointment. These are strict regulations that will, and that's where we are. We're in the red control category. This is about controlling things and being very precise in what we're doing. So in terms of hockey and some of those other activities that we're starting up, we were having basketball and volleyball programs look at the use of some of our arenas. Those things will all be curtailed. Obviously, we're providing refunds to everybody, and some very small targeted modified programs will come online in the next few days as we better understand what we can provide through our recreation programs.
Thank you. Councilor Danko.
Thank you. And maybe just could you speak to as well seniors programming? That's another specific sector that's been really impacted.
Sure. And again, through the mayor, there will be very limited offering in our seniors programming as well. Again, keeping those numbers down means that that we just won't be able to provide very many programs. Again, in the whole facility, 50 people in a room or two, you can maybe have up to 10 people. So those will be curtailed as well. And I understand that it would have been great to wake up this morning and know what everything is. We're going to be canceling more and then bringing stuff back online because we really need to do a hard reset on our recreation given the significant change for the next month or so. And this will carry us really through to the holiday season. Our recreation center usage in the holidays is down quite significantly anyway. So I think we'll use this. We'll do what we can in this next period and prepare for where we might be heading in January to open up more programs. And so people, again, our website is a great resource, and we will have more detail in the next couple of days about what we can provide. Very much the things we did, very much like what we did in the summer where we had to modify some things. We'll come out with that information. Today, my message, would be that don't expect many of the programs, the vast majority of our programs will be either closed or they'll be significantly curtailed. It will not look like it was leading up to Friday last week and through the weekend.
Thank you.
Thank you. And just one follow-up question, and we've had a couple discussions about this offline. Then that's the sort of higher level sports that use our city facilities. So in particular, there's the Kilty Bees and the Steelhawks that play at Dave Andrechuk Mountain Arena. And then, of course, the Bulldogs and Honey Badgers that play down at COPS. So will the city restrictions apply to those higher level spectator sports, or will there be provincial regulations that we're expecting, in particular with the Bulldogs as the OHL team?
So through the mayor, you're quite right. There is a division, and even within regulations, things like the Canadian Elite Basketball League, the NHL, the NBA, they have a different process for how they'll deal with that. So the OHL may fit into that. I understand they're not looking at starting up immediately, so we've got a little bit of time there. Things locally, you mentioned junior B hockey, things like that, that would be controlled under our guidelines, and the answer is they're not playing games. And so those pieces will all have to be pushed back if they were looking to start later in the month or early in December. That piece will be pushed back. The OHL is a question mark, but my understanding is they weren't looking at starting in early December anyways. So we have planned to sit down and chat with them just to get a sense of where things are at, Dr. Richardson and I, and then we'll see what the province is going to do with that as well.
Thank you. Lots of uncertainty and disappointment, certainly throughout the all the communities affected. But at the end of the day, this is public health and safety. So appreciate all the work that you do, and you know the attention to this. Thank you.
Thank you. I do want to compliment our staff. You know, as of Thursday, we were anticipating going into the orange category, which you know didn't level you know the level of restriction that we're talking about now, and so it was a bit of a surprise, but notwithstanding, we have to deal with it, and our staff have been playing catch up ever since. So the expectation that we have all the answers sorted out, you know, within a day or two, is a little bit too much to ask of our hardworking staff, but they're working on it day and night to get all the information gathered up so that we can share that information with the community at large. I've got second time speaker, Councillor Farr and Councillor Clark. Councillor Farr.
Okay, thanks, Mr. Mayor. I actually had a few more questions, but there was some good dialogue on the restaurant side of things by Councillor Jackson and Clark, and I'll just actually have one for Paul Johnson, actually our director of the OC. But I just want to, it sounds like, I just want confirmation, a yes or no confirmation. So earlier I chimed in on behalf of a local restaurateur. We're locally elected officials. We're obviously getting lots of questions, and absolutely there's confusion, and quite clearly right around the horseshoe, yourself and all the rest of us, including our multitude of staff. Safety is of paramount concern here. Public safety is the #1 reason for working hard on behalf of our residents. So on behalf of this one local restaurateur, whose fears are not isolated, obviously, for many people in the 30,000 strong industry, I was going to ask about closing times and last calls, but I want to be absolutely clear because I wasn't with the last time around with the first question. So we're in the red zone. It's the province's COVID-19 response framework, keeping Ontario safe and open. As Councillor Jackson alluded to, in order for we elected officials to best serve our local businesses that reach out to us, and they're going to continue to, we refer them to the federal government to apply for financial assistance, and we refer them to the local MPP if they're seeking answers or seeking efforts on their behalf to amend the matrix for restaurant capacities, as an example. So we have zero authority to adjust red zone requirements locally through you to Paul.
Thank you. And the doctor, quite frankly, so the MOH has their own authority, and the authority flows from their public safety guidelines, and I think the doctor can speak to that. But Paul, in terms of, do we have latitude on the red zone category?
So through you, Mr. Mayor, in terms of what comes out as provincial orders under those categories, no, and the regulations are set, and that's what we follow in our enforcement, and those are provincial regulations. So we, as Dr. Richardson has excuse me, pointed out, we could look at additional measures that might fall under her purview or under a bylaw. And the example I would use is our own masking bylaw and face covering bylaw earlier was something that we did in addition to the province. But in terms of what's laid out in their regulations, no, we can't deviate from that.
Perfect. Thank you very much. I appreciate that. And
Okay.
I also appreciate all the great work of all of our staff on this. Thank you.
Just to finish off, Doctor, can you outline your authority in terms of we could increase as Toronto has done. So Toronto's done a complete shutdown of gyms and restaurants on their own authority. So through medical officer of health, we could do that. I don't know anybody wants to, but you have authority to go above the red restrictions. And I think the province has been a little bit cute. So they created these categories and actually have done a bit of a download to municipalities on some of these regulations. And you know, the questions and concerns will likely come to municipalities more so than the province did previously. But Doctor, can you shed any light on any additional authorities you have?
Through you, Mr. Mayor, I think you stated it well. We can't either under the Reopening Ontario Act or under a Section 22 order under the Health Protection and Promotion Act make things stricter, but have no authority to make them to reduce what's already there under the regulations.
Okay, thank you. Appreciate that. Second time speaker as well, Councillor Clark and Councillor Pauls. Councillor Clark.
Thank you, Mr. Mayor. Just to clarify things for me and for the businesses and residents in my community. These orders came down from the provincial government, and yet today I've heard a number of staff, and I won't highlight which one said it, but they use the term guidance, guidelines, as opposed to requirements. And it's a guideline or it's guidance. I've got businesses saying, so we don't have to follow that. So why are we using that terminology as opposed to a requirement? It's an order, it's a provincial order. They must comply.
Through you, Mr. Mayor, I think it's the language we're comfortable with in terms of it's what we use every day. But you're absolutely right. These are regulations that have been put in place at the provincial level that direct business, all the various things that they do direct. And as well, there is guidance to workplaces in terms of things you can do, how to do it. Like there's always some level of helpful support, if you will, in order to how you can follow those regs. But you're absolutely right. The regulations are the regulations.
So we need to start stressing to the broader community that they are regulations, they are provincial orders. We didn't make these orders. However, based on the way the act is written, we have to enforce those orders. So it's our guys that are out there doing the enforcement, not the provinces folks that are doing that. Can I ask you a question about malls? I was advised, I don't like malls. I didn't go to the mall, just to be clear. Don't like shopping either, just to be clear. But I was told that the mall was absolutely jam-packed with thousands of people. And so how do we deal with that? Where on one end, we're telling people socially distance, wear a mask, and incidentally, there was lots of masks not being worn in the mall, including by salespeople. How do we, there just seems to be a lack of consistency. On one side, the province is making restaurants 10 people only, but a mall, have as many people as you want.
Doctor?
Through you, Mr. Mayor, I think the issue of malls is one, in general under retail, they are asking, for some screening at mall entrances. They're asking for a safety plan. And I think all the devil is in those details of safety plans and what should be in them. Back to your point about guidance versus regulation. And I think this is one area where, should there be something clear about this? You'll note in the framework initially, it suggested that maximums be developed. I think they're just not there yet on it. And it's just busyness and work. It's not about, and about getting that done.
And I guess my nervousness is that we've got all these people getting ready for Christmas, going out shopping, and a bunch of people who refuse to wear masks because they're exempt, which I question whether or not they're exempt. Some are, but they seem to be anti-maskers who are saying, walking through the door, big muscular guy works out clearly 3 or 4 times a day. Says, sorry, I'm exempt from wearing the mask. Yeah, I think you just don't want to wear the mask. And they're mixing with the broader population. And so I'm just worried when I see this exponential growth happening that it's not all happening in the restaurants. There has to be other mechanisms at play where people are coming into contact with carriers. And it would appear that the volume in the malls and these large box stores like Costco and Home Depot, like people, it's huge crowds now. So how are we supposed to deal with that ourselves as a municipality now? Or is it the province that will be setting how many people can go into these retail establishments?
Through you, Mr. Mayor, there is, of course, already our distancing bylaw and our masking bylaw would apply in these establishments regardless. And then the issue of what more to do, we could begin to tackle that locally. And I can tell you it's very much a topic of conversation amongst the medical officers about what to do on that front, and very much trying to balance the economic and the transmission issues that are related to it. From a disease control perspective, we do gather data from everybody and look to see if we see anything happening in those settings. Fortunately, we have not. Most of ours, if you'll notice, over 70% of ours, we are able to identify the source. And it's most often somebody in their home or where they're out socializing with that individual directly. Rather than being these settings, but it is something that as numbers go up, that we're concerned about and we are discussing.
last question is contact tracing. Where are you in you had a proposal that you brought forward that council supported for the hiring of additional help for contact tracing. Did we fulfill that request, or are you still looking for additional help?
I'll turn to Jen Vickers-Manson. We've gotten a long way along with it, about probably, I would say, about 80% of the way in all the staff, not just for contact tracing. We did have to hire some additional public health nurse support to the schools, and then we got the additional 15. But Jen, where are we at?
Sorry.
Sorry.
She's coming. Yep.
There we go. We're just asking in terms of hiring the 75 FTEs and particularly the contact tracing element within those. Are we completed hiring all of those staff?
Yeah, we do have through the chair. So we have hired all of our contact tracers. And as you know, Michelle has been reaching out and working with Public Health Ontario and the ministry around getting some additional staff to support that piece of work as well.
Thank you.
And just finally, I do want to personally thank yourself, Dr. Richardson, and all of your staff. You're doing a yeoman's job. This is very challenging times, as the mayor has indicated. And the expertise that we have within our public health department has helped us greatly through this process. And I wouldn't want to be trying to do this without you folks, because it would just simply be impossible. So thank you for everything you're doing and all the overtime that you're putting in. It's really appreciated. Thank you.
Thank you.
Great. Thank you very much. Councillor Vanderbeek, first time. Can't hear you just yet. You have to unmute yourself.
I know. I was trying to get to the mute button.
Right.
Thank you, Mr. Mayor. Through you to, I guess, whoever can answer this, whether that's Paul Johnson or Dr. Richardson or Dr. Harvey. I have had several, as have many, emails, especially from restaurants. And I think that we need to be cognizant of the fact that we've just passed and approved the ability for staff to identify restaurants who are not compliant. So the restaurants are extremely worried about compliance, given these new rules. But some of the questions they've asked me seem simple, but maybe not. So I would like to ask a couple of questions, and I'll do it quickly. And I'm going to do a few at a time so that they can be answered as one question, I think. Outdoor dining is limited to 4 people per table. I suppose indoor dining is too. Does the limit mean that they have to all be from one household? And is there a limit to the number of patrons that use the outdoor space, the patio? I think it's 25, but I'm asking the question because several have asked. And some of them have separate banquet rooms or extra rooms party rooms where they could put people in seclusion. Does the 10 people mean 10 per room or 10 per facility?
Paul Johnson, I think. I don't know where Dr. Richardson went, or possibly take a break. Paul Johnson, you're on the call, and can you clarify any of those requirements?
Through the mayor, just so we're really clear, we may, if Bart or Nin have an answer, we can do that now, or else it might be best to email that out so that there's some real clarity on that. There's a number of things in there, and the problem is it depends, because event space is different. The restaurants are not supposed to have several rooms that would add up 10, 10, 10, 10, but if something's an event space, it might be a little bit different. Dr. Tran's been working on this with our bylaw enforcement folks, so if you've got some of those crystal clear answers, Nin, that'd be great. If not, we can take it away and send out something.
Not for mixed use spaces, but within a restaurant, it's facility-wide 10 indoors.
Okay, and so if they had a party room, that includes the party room, is that what you're saying? Even though it might be a room with a door?
The 10 you would include the party room, presumably.
So it would, okay. Okay, and the 4 people per table, do they have to be from, are they regulated that they must be from one household? Through you, Mr. Mayor.
To you, Mr. Mayor. That's not spelled out in the regs. However, as Dr. Richardson mentioned, that's our recommendation, is that people should only be within close contact within their own household.
So for, I'm a restaurant owner. I'm not. I'm just saying, if I were a restaurant owner and a group of 4 people came in, am I required to be sure they're from one household? Bylaw is going to walk in that door. Are they going to ticket them because it's a grandmother and a grandfather and 2 grandchildren and they don't live in the same house?
Through you, Mr. Mayor, if I might.
Please.
I think these are the challenges that everybody acknowledges about enforcing the regulations, and whether it's the 10 people piece or whatnot. And this is where I come back to, you know, the advice versus the regs. It's very, very difficult to get into that level of detail in terms of enforcement. And so the enforcement is, as Dr. Tran said, limit of 4 people, limit of 10 people, 4 people at a table, limit of 10 people. But our advice is make good choices. Choose to just do it with your close contacts.
That's not good enough for a restaurant owner who is going to be subject to our bylaw official who comes in.
Through you, Mr. Mayor, that's what I'm saying is they will not, the bylaw officers will not come and ask, was it a household member or not? That is not part of the regulation.
Okay.
It's just 4 from that perspective.
Okay, and that's clarity. I think it all comes back to, I totally understand that this is only several hours old, and even if you count the weekend, and so I totally understand that we do not have all the answers, but I like one of my colleagues mentioned, would really appreciate some clarities to some of those regular questions that restaurants and retail stores are asking. I'm getting asked about retail stores. So small business can only have whatever, and the box stores have hundreds. And I mean, I happened to be up by Meadowlands on Saturday, and they were lined up to get into Costco. So I really think that as soon as possible, we really need people to be able to understand clearly what our bylaw people are going to be enforcing. And that people can comply and comply readily, both the person using the business and the person owning the business. Thank you. That's my questions.
Thank you. And I would also recommend that we get back to having a facilitator answer questions quickly from members of council. We're getting a lot of questions from a lot of places. It worked particularly well, you know, in March, April, and May, that we can get, you know, a good flow through of questions to the right people and answers coming back promptly. So why don't we get back to that process and identify someone that can do an effective job. I don't remember. She did a terrific job. Don't remember her name, but if you would, you know, maybe re-enlist her to do that, I think that'd be very, very helpful in terms of streamlining this process.
If I may jump in, Mr. Mayor, just to that, I can confirm that this morning at our EOC call, that actually was discussed, and I know that Ken is looking at it. It may not be the same individual, but we are looking at how that could be there because of the number of questions that we anticipate we're going to receive and have already received. So just to let you know, we're working on that as we speak.
Perfect. That's great. I think that'd be very, very helpful because I think the questions are going to continue to come, and you know, the greater clarity that we can provide quickly would be helpful. And I take Councillor Clark's point that, you know, identifying on our websites which ones are requirements or required actions as opposed to advice or recommendations, I guess, would be, I think, somewhat helpful at this point because, you know, we had recommendations when things were a little bit more relaxed. Now they've turned back into requirements, not just advice and recommendations. So I think that might be helpful to clarify as well. But I'll leave that with you. First-time speakers, Councillor Marula. We do have second-time speakers, and we do need to wrap up at some point, folks. So we have Councillors Pauls and Wilson thereafter. Councillor Marula, go ahead. You have to unmute yourself, Councillor Marula.
My apologies.
No problem.
Just with respect to restaurants. So, in reading all of the outbreaks that we've experienced, not only in Hamilton but throughout the province, I'm not reading that the source of the outbreaks are restaurants per se. And correct me if I'm wrong, but have we tracked where the outbreaks have occurred and how many outbreaks have occurred in actual restaurants as opposed to people transferring the virus from one other location to a restaurant? Case in point, the Radisson.
Through you, Mr. Mayor, I don't have the numbers.
Radius, sorry.
Through you, Mr. Mayor, I don't have the numbers at hand. I think here in Hamilton, as I said at the beginning, we have been fortunate in that the transmission has been among staff, and often we're not sure it happens in the restaurant as opposed to elsewhere that they may convene or socialize. My understanding from my colleagues in discussing these issues across the province is they have definitely seen transmission from patron to patron, patron to staff, staff to patron in restaurants. And I can think of two significant examples just right off the top of my head, and specific ones that are very significant. And so that's where the concern is coming from.
Okay. I think through you, Mr. Mayor, if we can maybe communicate that a little clearer, because I think the understanding with many restaurateurs is that they're being victimized, but yet they're not considered, or they're not considering themselves to be super spreader locations, kind of, if for lack of a better word. So everyone's feeling badly for the restaurant industry. Let's face it. I'm surprised many are still open, and I'm not sure how many are going to survive. But having heard that the science dictates and concurs with the measurements we've put in place, I think we just need to really, really, really strongly communicate that regularly. And I appreciate it. Thank you.
Good point. Thank you, as we should. Councillor Pauls?
Thank you. Really a quick question, just I want to see clarity. Dr. Richardson, if, let's say, I put myself into it, if I'm a provider, childcare provider for my son, I have 4 sons, I have 9 grandchildren, one of them gets sick, they have to go to work, can I watch my grandson or granddaughter?
Through you, Mr. Mayor, I think, as consistent with what we were talking about before, we all need to do what we need to do in urgent situations. There's no doubt of that. And if we're going to step into that, that's where we say, do things like wear a mask, stay distant if you can. If you're looking after a 10-year-old, it's very different than if you're looking after a 2-year-old in terms of the measures that you can take. And so we all need to use good sense, good common sense, of which I know you have tons, Councillor Pauls, and in those situations, and look after things that are urgent. But on a day-to-day basis, look at things from a different point of view.
All right. So this is not just for I had few email clarifying because they do take care of their grandchildren and they wanted to make sure they can continue to do that. So if they...
Through you, Mr. Mayor, I think there's 2 very different circumstances. There is a circumstance where you are an essential support for a family so they can continue on to work and do all those things that they do. Similarly with a tutor, similarly with, anybody who needs a healthcare provider who come in regularly into the home. That's very different from an urgent situation where you're going to do something or you're going to start something anew.
Okay. Thank you.
Thank you. Councillor Wilson?
Thank you. Sorry, Dr. Richardson, I may have missed it. When you were speaking that we can go stricter, have you identified those thresholds that will inform whether you think we need to go in that direction? Thank you.
Through you, Mr. Mayor, I think we're all contemplating about what might take us sort of generally into that gray zone that is a much stricter area. And with the discussion and dialogue that's happened over the last week, that continues to be an area of discussion. We haven't decided anything in that regard, nor the specific measures that we take. It's something that we continue to decide on a case-by-case, issue-by-issue basis, as you've seen us do when it came to fitness facilities earlier this year. But we will continue to work on that. Ideally, we're going to work on that together as a province so we have consistency. But if we need to, we'll take stricter measures where we must.
Thank you. Okay, I see no further speakers at this point. Thank you so much, Doctor, and Dr. Tran, Dr. Richardson, Stephanie, and Paul Johnson, and everyone else that's participated here. And again, let's put that process in place so we can get some of these answers for the questions that we're all getting as quickly as humanly possible. I need a motion to receive this report, moved by Clark, seconded by Pauls. All in favor, that'll be electronic vote. And it's coming. Go. And again, we're going to continue our press conferences and may even step them up given where we are currently. And we'll keep the information going to council as well as often as necessary. Councillor Partridge for, oh, thumbs up. Okay, for vote. I'm sorry. Thank you. So if you're going to throw a speaker at me, I'm going to go, no. Thank you for that. Thank you. Can I have a motion to approve session minutes of October the 19th, 2020? Moved by Jackson, seconded by Farr. Any questions or comments on it? Again, an electronic vote. All in favor or opposed or otherwise? Lauren is whistling her way, whistling while she works. Just nice news. Almost there. I see the e-scribe wheel turning. Okay, an extra moment. I can take a thumbs up, and I'm sure it's going to be unanimous. Okay. Thank you. And again, I with certainty know that's going to pass. Thank you all for a very important meeting. Yes, not great time to be in this circumstance, but we have good people working on this, and I'm grateful for that. Some of you have indicated that, and that has been the case right from the very beginning. So let's continue to support our public health and all those that are doing their best to keep us all safe. I'll take a motion to adjourn, moved by Jackson, seconded by Clark. All in favor? Thumbs up. I'm gonna do a manual vote on this one just for fun. Thank you all very much. That was, and we will talk to you later. Have a good day.